country and everybody. Morning country and everybody.
Selamat pagi dan salam sejahtera. Welcome to MIND's fourth National Conference of Contribution to National Development by Malaysian women scientists and inventors. Professor Engineer Dr. Leong Wai Yi, Chairperson, Professor Emeritus Dr. Bu Nam Yun, Keynote Speaker, eminent speakers, distinguished participants. Understand we have 192 participants from 60 organizations, ladies and gentlemen. MIND is very proud to organize the fourth consecutive annual conference to highlight the achievement of Malaysian women researchers, scientists, and inventors in connection with the celebration of Women's Day. We will continue this practice annually. For 2023, we would like to recognize the good work of Yang Bahagia Dr. Chu Yan Mei, the chairperson of the organizing committee and members of a team. Due to unforeseen circumstances, Dato' Chu is unable to be present and Professor Leong will preside the whole event. It is my great pleasure and honor to congratulate Emeritus Professor Dr. Bu Nam Yun, the recipient of Outstanding Woman Scientist Lifetime Scientific Research Achievement Award 2023, and Associate Professor Dr. Lam Saiman and Dr. Nur Hafiza Abdul Khalid, co-recipients of Young Woman Scientist Award 2023. I would like to express my deepest appreciation to all our eminent speakers and distinguished participants. My thanks also go to members of MIND Secretariat for making this event a reality. Good, thank you.
Thank you, Tan Sri, for your kind words. Good morning, Yang Bahagia Academician Emeritus Professor Tan Sri Dato' Dr. Agustin Ong Sun Hock, President of MINDS, Yang Berbahagia Dato' Dr. Chu Yuan Mei, Vice President of MINDS, Chairperson of LadyMINDS Chapter and Chairperson of the Conference Organizing Committee, Yang Berusaha Professor Emeritus Dr. Bu Nam Yun, Dr. Ravika Devi, honored guests, distinguished speakers, participants, members of the media, MINDS Council members, ladies and gentlemen. I am honored to chair the keynote address and section 1 of the conference today. The keynote address will be delivered by none other than Professor Emeritus Dr. Bu Nam Yun, the recipient of the MINDS 2023 Outstanding Woman Scientist Lifetime Scientific Research Achievement Award. Professor Bu is an internationally renowned neonatologist. She is a medical doctor by training, a teacher, and an administrator who has contributed much through her lifelong research to the improvement of neonatal care both in Malaysia and internationally. Without much ado, it is my pleasure to invite Dr. Ravika Devi, MINDS Council members, to do the citation for Professor Bu. Dr. Ravi, the floor is yours. Thank you very much.
Thank you, Professor Leong. A very good morning to Tan Sri Agustin Ong, President of MINDS, Dato' Chu Yuan Mei, Vice President of MINDS and Chairman of the Organizing Committee of this conference, who is unfortunately not able to be with us today. Esteemed participants of the conference, ladies and gentlemen. The birth of a child is a life-changing event. The neonatal period, that is, the first 4 weeks of life, is one of the most critical phases in the survival and development of a child. Neonatologists or doctors who take care of newborns often care for babies born at the age of survival. They look after the tiniest patients and get a chance to make a huge impact at the start of a child's life. They are thus an integral part of the baby's survival and their family's dreams. Prof. Bu Nam Yun is one of the foremost neonatologists in the country and became the first professor of neonatology in Malaysia. Having graduated from the Faculty of Medicine, University of Malaya in 1975, She went on to obtain her postgraduate MRCP in pediatrics in the United Kingdom in 1978. On returning to Malaysia in 1980, she served at the neonatal intensive care unit and the postnatal wards of Maternity Hospital, Kuala Lumpur. In 1982, she joined University Kebangsaan Malaysia as a lecturer and continued to work at the maternity hospital as a neonatologist till 1997. During these 17 years at the maternity hospital, Kuala Lumpur, the number of babies delivered increased by about 1,000 a year, from 18,000 in 1978 to 26,000 in 1994, overtaking the world-famous Kandang Kerbau Hospital of Singapore as the maternity hospital with the highest number of deliveries in Southeast Asia. Professor Boo was the only neonatologist working at the maternity hospital, Kuala Lumpur, during most of this period. The neonatal intensive care unit was always overcrowded and acutely short of manpower. Hospital-acquired infections and neonatal death rates were very high. To improve the overcrowding problem, Professor Boo focused on reducing hospital-acquired infections and preventing severe neonatal jaundice so that babies could recover fast and be discharged home earlier. She began to systematically collect data on potential factors associated with hospital-acquired infections and neonatal jaundice and analyze them to identify more solutions. This marked the beginning of a clinical research journey in Malaysia. The large number of deliveries provided her a golden opportunity to study the epidemiology and burden of various newborn diseases in Malaysia so that more comprehensive treatment plans could be put in place for them. In 1995, Professor Boo became the founding chairperson of the Malaysian Neonatal Training Program. She organized a systematic and sustainable national program modeled on the American Academy of Pediatrics Neonatal Resuscitation Program to train healthcare providers from all states in Malaysia. She created a database recording all the training activities of the program since its inception and published the findings in 2 papers in medical journals to document the impact of this program. In 1997, Professor Boo left the maternity hospital and started to work at the newly built hospital UKM in Cheras, where she designed and established the neonatal intensive care unit, the first developmental care-friendly neonatal intensive care unit for sick newborn infants in Malaysia. She continued to carry out research on various aspects of newborn care until her retirement from UKM in 2005. Prof. Boo's research has provided invaluable information on the epidemiology of numerous conditions in Malaysian newborn infants, including Down syndrome, congenital dislocation of the hips, and cleft lips. She also identified common risk factors associated with severe neonatal jaundice in Malaysia. This information will help improve neonatal policies to prevent brain damage resulting from severe neonatal jaundice. She also discovered genetic variants which predispose Malaysian newborns to severe jaundice, paving the way for the development of genetic screening programs for identifying those at high risk of severe neonatal jaundice. Upon her retirement from UKM in 2005, Professor Boo joined the International Medical University as a professor of pediatrics. In 2008, she was made a Fellow of the Academy of Sciences, Malaysia. In 2010, she joined the Faculty of Medicine and Health Sciences of the University Tunku Abdul Rahman as Senior Professor of Pediatrics, where she still serves and continues her clinical research in collaboration with local hospitals. In 2012, She was conferred the honorific title of Emeritus Professor for her teaching, research, and service contribution to UKM. Professor Boo has authored and co-authored 167 publications in peer-reviewed medical journals. She was ranked among the top 2% of career scientists in pediatrics in the world and among the top 2% single recent year impact scientists in pediatrics in the world for 3 consecutive years from 2019 to 2021 by the Stanford University of USA. Ladies and gentlemen, please join me in applauding Professor Boo Nem Yoon, recipient of the Minds Outstanding Woman Scientist Lifetime Scientific Research Achievement Award for her pioneering contribution to innovative medical care, education, training, and research, especially in the field of neonatology. Thank you.
Yang berbahagia Academician Emeritus Professor Tan Sri Datuk Dr. Augustine Ong, President of MINDS, Yang berbahagia Datuk Dr. Chu Yuan Mei, Vice President of MINDS and Chairperson of LadyMINDS Chapter, Professor Engineer Dr. Leong Wai Yi, Vice President of International Network of Women Engineers and Scientists, and Council Member of MINDS, distinguished guests, ladies and gentlemen, good morning. Thank you, Dr. Ravika Devi, for reading the citation. I would like to thank the MINDS for presenting this prestigious award to me. It is indeed a great honor. I would also like to thank my collaborators, my past and present colleagues, my postgraduate students, University Kebangsaan Malaysia, University Tunku Abdul Rahman, and my dear husband, Academician Emeritus Professor Dr. Cheong Soon King, for their support during my research journey over the last 40 years. Thank you very much. The title of my talk is A Research Journey to Improve Care of Newborn Infants in Malaysia. Before I share the story of my research journey with you, I would like to tell you a little about my profession. I'm a neonatologist who's a pediatrician specializing in newborn care. The scope of my work consists of counseling mothers of high-risk babies before their deliveries, attending the birth of high-risk babies in labor room or operation theater, resuscitating sick newborns, taking care of sick newborn infants in the neonatal intensive care units or NICU, performing screening examination of newborns after birth, and reviewing the progress of high-risk babies in the clinics after their discharge. I graduated from University Malaya in 1975, and after obtaining my postgraduate degree and working in UK for about 2 years, I returned to Malaysia in 1980. I was stationed in the maternity hospital Kuala Lumpur, first under Ministry of Health of Malaysia, and then later under UKM when I became a lecturer of UKM. The maternity hospital Kuala Lumpur is part of the Hospital Kuala Lumpur complex. I worked in the maternity hospital Kuala Lumpur for a total of 17 years. During those 17 years, the newborn delivery rates increased rapidly annually, from 18,000 in 1980 to more than 26,000 by 1988, and remained around that level until 1997 when I left the maternity hospital. During these 17 years in the maternity hospital, the NICU and postnatal wards were overcrowded with newborn babies because of the high delivery rates. and there was severe shortage of neonatal staff, beds, equipment, and facilities, including infant incubators and ventilators in the NICU. The MHKL was nicknamed the Siberia of Hospital Kuala Lumpur by pediatricians because of high number of newborn deliveries, morbidities, and mortality rates. I was the lone neonatologist in MHKL during the most part of the 17 years, assisted by 3 to 5 medical. The screening examination of every newborn baby from head to toe shortly after birth is a very important procedure. The objective of screening examination are to ensure each newborn is healthy and normal before discharge, and to detect and provide early treatment whenever necessary in any newborn with birth defects, birth injuries, or any illnesses. Because of a large number of deliveries, the number of sick newborns admitted to NICU was also very high. To decongest NICU and to improve quality of care, I started to carry out studies to identify factors predisposing newborns to the 2 most common problems in NICUs: hospital-acquired infections and severe neonatal jaundice. The large number of babies born daily in the hospital provided me the opportunity to carry out systematic studies on the epidemiology and risk factors associated with several major birth defects and birth injuries. The objectives of this study were to help us and policymakers to make plans to provide adequate facilities and support for these high-risk babies. These research activities marked the beginning of my clinical research journey. I would like to share with you some of the birth defects I've studied in this hospital. The first one is cleft lip and cleft palate. The impacts of cleft lip and palate on patients are numerous. These include facial appearance, feeding and growth problems, hearing impairment, speech problems due to palatal and hearing problem, dental problems, child's learning ability due to poor speech and hearing, psychological problem due to poor self-image and an unclear speech, and later in adulthood, employment problems. I did a study to find out how common is this condition in this hospital over a 2-year period. We found the incidence of cleft lip and cleft palate was 1.24 per 1,000 live births. The Chinese baby had the highest incidence, while the Malays had the lowest. And the most common type was the unilateral cleft lip and palate. And 10.9% of the mothers of affected babies had positive history of drug ingestion, especially Chinese herbs during pregnancy. And other epidemiological studies of congenital abnormalities that have done in the maternity hospital include Down syndrome, congenital equinus virus, that means abnormalities of the feet, which with early identification and treatment lead to much better prognosis and function, and also congenital dislocation of the hips, which we could detect by the screening examination, and with early treatment from newborn, we could cut down a lot of need for complicated and painful surgery later on. I also carry out epidemiological studies on 2 major types of birth injuries in MHKL. This slide shows the layers of the scalp. And the outermost layer is the skin. Below that is the connective tissue. And below the connective tissue is the aponeurosis. And below that is the loose areolar tissue. And below the loose areolar tissue is the periosteum covering the bone of the skull. And there are numerous blood vessels supplying the scalp. The scan. And there are three common types of scalp injury in newborn infants. At the top is the caput succedanum, which is the most benign. Essentially, it just fluid accumulated below the skin, and within a few days after birth will disappear. At the bottom is the Kapha hematoma, the next group. It is the bleeding below the periosteum and just above the bone. And this bleeding is usually limited by the periosteum, which is attached to the edge of the bone. Therefore, the bleeding will not be extensive. In the middle group is the subgaleal hemorrhage, which is the most serious type of bleeding because the bleeding occurs in the loose areolar tissue, and therefore there's nothing to stop the bleeding. And this is the side view of the when there's bleeding in the subgaleal or subaponeurotic area, that's the areolar tissue, and the bleeding can extend very rapidly from front to back and from side to side. It is a serious and often fatal birth injury. The cause of death is due to extensive blood loss and shock, and it is usually very painful. And if the baby survives, they usually have anemia and jaundice. And I saw the first patient with subaponeurotic hemorrhage in my life in maternity hospital shortly after I started work there. Now this is a very common condition and started to systematically collect data to find out its incidence. And over a 30-month period, we found that the incidence of this condition was 1.6 per thousand live births, and the incidence was highest in babies, big babies weighing 4 kilos or more. And usually about 2/3 of the babies with the subaponeurotic or subgaleal hemorrhage had a history of trial or vacuum extraction. And the incidence was 41.4 per thousand live births in baby delivered by vacuum extraction, compared with those delivered by other method where the incidence was only 1 per thousand live births. During delivery of a baby through the birth canal, some mothers encounter difficulties to push up the baby. So the obstetricians try to assist the delivery by applying either a pair of forceps or the vacuum cup to the head of the baby to help to pull out the baby. The forceps has been found to cause more injury to the birth canal of the mother than vacuum extraction. As a result, the vacuum cup has become a more popular method to assist delivery by the obstetricians. And our epidemiology study has shown that subaponeurotic hemorrhage is more commonly associated with vacuum extraction, which I'm going to show you in subsequent slides, subsequent parts of the lecture. Another group of birth injury that I've studied is brachial plexus injuries, because I also saw quite a number of babies there. And this is a condition, again, due to difficulty in delivering the body of baby after the head came out, and the obstetrician need to pull on the head to try to get the body out. And the part that gets pulled is at the nerve root, and it might either cause the stretching of the nerve root or the nerve root might be torn. So when we do screening examination, we'll find that if it's affected only one side, this baby whose right side is normal, we're able to move it while the left side is paralyzed. So this is the way that we can diagnose them. And we did an epidemiological study of this injury over a 12-month period and found the incidence of 1.6 per thousand live birth, and occurs mainly in bigger babies and those who were delivered by breech deliveries. This finding helped us to be more alert to screen carefully on all those big babies and those delivered by with difficulty in delivery and those delivered by. As I gained more experience in planning research and conduct research, I started to study 6 babies who were very premature, less than 32 weeks gestation, or who are very small, weighing less than 1.5 kilo and birth of the mature term sick babies. The objectives were to determine the burden of the problems and any preventable factors, and then effective low-cost treatment methods to improve survival and quality of life. I would like to show you the example of some of the studies I have done in the NICU on maternity Kuala Lumpur. One of which I've done was on the hearing loss in term babies with severe jaundice. And I worked with our audiologist, Mr. Michael Pope, and using brainstem auditory response. This is the equipment we use to test the hearing of the baby, and found that baby who has severe jaundice, so severe that need exchange transfusion, or when this severe jaundice occur early, they have high risk of hearing loss. And this alerts us that when discharged, even though the initial hearing test could be normal, we will continue to repeat the hearing until 2 years of age. Another group of conditions that we saw quite a lot in the hospital was this condition called necrotizing enterocolitis, or NEC, and affects the guts of the babies and cause the gangrene. And if the surgeon do not resect them, did not diagnose them early or resect them, they will die. When we found this condition, the incidence was 2.4 per thousand live birth in the hospital, and affecting many very low birth weight babies of less than 1.5 kilo and preterm baby less than 34 weeks. And it's commonly occurring during the first week of life. So alerting us to be very alert for this, and later it helped me to find ways to prevent and minimize occurrence of condition. Another group of condition that we have studied is on the retinopathy of prematurity, or ROP, which is an eye condition found in premature babies. In the mature babies, the blood vessels in the retina usually develop fully by the time they were born. But if they were born premature, this blood vessel growth will be interrupted, and then under hypoxic condition, abnormal blood vessel development occur, and these vessels are usually blood vessels are very fragile, and they bleed and cause scarring or fibrosis, and this scarring contract, and they will cause the retina to be detached and lead to permanent blindness in the baby. So and other elsewhere in the world, people have found that oxygen therapy, essential oxygen therapy, is a risk factor. So I decided to study this condition in our hospital, and I worked with the ophthalmologist, Dr. Teo Sulin, and the significant risk factors we have found was, again, we confirmed that increasing each day, increasing in duration oxygen therapy will increase the probability of developing ROP. And we also found that if this baby was so sick with sepsis or for whatever reason, we need to do exchange blood transfusion, again, the risk will be even higher. And because of these findings, we try to limit the duration of oxygen therapy once the baby did not need it, and we also change our methods of treating anemia in subsequent years, especially when we moved to UKM, and we use less blood transfusion and use another drug to help the baby to produce their own hemoglobin. And in 1988, I acquired a small but very useful portable ultrasound machine, which enabled me to ready scan sick babies at the bedside in NICU and rapidly and accurately diagnose many birth defects and complications in the brain, the abdomen, and the hearts of sick newborns, and provide more targeted treatment and support for sick babies, and improve the treatment outcome, and carry out research in sick newborns, and become skillful in doing and teaching ultrasound scanning in sick newborns to my postgraduate students. And this slide show how we do ultrasound of the brain in newborns. In newborn, all the scars bones are not all fused together yet. In the middle part, we call the sagittal suture, and in the back, the posterior part, and also anterior part. And there's a space called the anterior fontana, which is still not fused, and also the posterior fontana. It's just at the anterior fontana, which is much bigger, allow us to put the ultrasound probe to look at the whole parts of the brain from front to back and from side to side. In the preterm newborns, they have very fragile blood vessels on the floor of the lateral ventricles, as shown here, and they tend to bleed very easily. And the severity of the bleeding can be graded from grade 1, when it's very mild, to grade 4, when it's very extensive, damaging even the surrounding brain tissues. Using the ultrasound machine, we are able to detect and also grade the severity of this intraventricular hemorrhage as shown in these slides. So using the ultrasound machine, we are able to conduct a study on the incidence of periventral, intraventral hemorrhage in very low birth weight babies in the maternity hospital. And we found that the hemorrhage was occur in 98% of the babies we studied, and 8% of them had grade 3 and 12% had grade 4 hemorrhage. And death occur in 50% of those who have grade 3 or grade 4 hemorrhage. So this study alerted us to the need of regular scanning of these babies to detect this problem and to take actions to prevent the occurrence of this condition. And we also do long-term follow-up study of these babies that have scanned. And in one of the study, we actually follow them up until the age of 4 years to look at the neurodevelopment outcome, together working with my pediatric neurologist and pediatric psychologist to look at the behavior and the cognitive function. And we found that social factors and caregiving environments were very important determinants of cognitive and behavioral outcome. And cranial ultrasound abnormalities are found in the later part of the newborn period, and the development status at 1 year of age were useful to identify the high-risk babies needing long-term and we also did ultrasound studies on babies who had asphyxia with brain damage called hypoxic ischemic encephalopathy. And these are some of the ultrasound changes we usually see. And we reported some of the we have done on them. In 1997, the UCAM staff shifted from Hospital Kuala Lumpur and the maternity hospital to the new Hospital UKM in Cheras. Here, my clinical research will continue in the newly designed NICU. I would like to share with you some of the studies I've done in the Hospital UKM. The new NICU of the Hospital UKM consists of numerous individual cubicles, and each cubicle has its own lighting control. And the lights of each cubicle can be dimmed in the evening to promote calm and sleep for the babies. And this individual cubicle also provide privacy for parents when they visit the babies and during breastfeeding and when they carry out kangaroo care. Unlike NICU elsewhere, which are usually of the open ward design with 24-hour lighting on, and it's usually very crowded and noisy and no privacy for the parents. Because in recent years, we found that preterm baby will sleep better in the dark environment. So in this style of NICU, they usually cover the the incubator in this cloth. So unless you have continuous 24-hour monitor, you might not know what's happening to the baby under this cover. The design of the NICU in Hospital UCAM allow us to carry out a randomized control study to compare the weight gain between preterm infants exposed to 12 hours of lighting and 12 hours of darkness with those who were exposed to a continuously dim environment. We found that there was no significant difference in weight gains between these two groups of infants. The individual cubicle, which provide privacy to the parents, allow us to study the impact of kangaroo care on growth and breastfeeding of very small babies. And during kangaroo care, the baby lies without clothing on the mother's chest or the father's chest, and the baby just wears a cap and a nappy and covered by a blanket to prevent hypothermia due to the aircon condition. And during the study, we compare the weight gain and head growth between babies who were given kangaroo care or without kangaroo care for about at least 1 hour a day until they're discharged from the NICU. And we found that exposure to this short duration of kangaroo care help to promote the head growth in very small babies, and which means that it might help the brain growth as well. So there's a very positive effect, and now kangaroo care is now a standard care practice in the NICU of UKM. Because of a previous study on subaponeurotic hemorrhage, identify vacuum extraction as a significant risk factor. So we went on to do the next study to identify the risk factors associated with subaponeurotic hemorrhage in these mature babies exposed to vacuum extraction. And all babies for vacuum extraction have a mark on the scalp at delivery. So we could measure the distance of this leading edge to the anterior fontanelle, and also the position of this vacuum cup marks in relationship to the sagittal suture, the midline suture here. And so we found that among the 338 neonates who had exposure to vacuum extraction that we studied, 21% of them actually developed subaponeurotic hemorrhage. And using multiple logistic regression analysis, we identified that placement of the vacuum cup over the sagittal suture, and when the leading edge of this cup is less than 3 centimeters away from the anterior fontanelle, these were two very significant risk factors associated with the development of subaponeurotic hemorrhage. And the finding of this study have been cited in many big obstetric textbooks to alert the obstetric doctors not to place the cup too close to the anterior fontanelle and to avoid placing it over the sagittal suture. Previously, all mature term babies admitted for intensive phototherapy for treatment of severe jaundice were given an intravenous drip. However, you notice many of these babies were very hungry and wanted their milk. So we decided to do a randomized control trial comparing the oral versus intravenous fluid supplementation on the serum bilirubin level during phototherapy. We found that both groups had similar rates of decrease in serum bilirubin level during the first 4 hours of intensive phototherapy. So this finding therefore help us to understand that oral feed is as effective and we can avoid the need for intravenous setting an intravenous drip and the attendant complications. This paper is now cited by many clinical practice guidelines in many parts of the world for treatment of severe jaundice. After my retirement from HUKM, I continued to do some research. One group of studies I carried out was based on the data submitted to the Malaysian National Neonatal Registry. I was invited to be a member of the steering committee of the registry, and the participating NICUs submit their neonatal data prospectively to the registry. By the year 2020, there were 44 Malaysian NICUs in the registry. They include all the major MOH hospital NICUs, one university hospital NICU, and a few private hospital NICUs. So we started to carry out studies to investigate incidents of common illnesses, complications, and causes of death in newborns admitted to Malaysian NICUs, and the potential modifying factors which would improve outcome of sick newborns. This slide is from the World Bank, and it shows that the neonatal mortality rate in Malaysia has been increasing since 2015, gradually over until recent years. And this is worrying. And the top 3 leading causes of neonatal mortality in Malaysia were prematurity, congenital malformation, and birth asphyxia. In order to reduce the neonatal mortality rates in Malaysia, we decided to carry out a study on the 10-year trend of care practices, morbidities, and survival of very preterm newborns admitted to the Malaysian NICUs using the data in the Malaysian Neonatal Registry. And in this study, we identify a few factors which are significantly associated with increased risk of mortality in the very preterm babies. And these are failure to use antenatal steroid, failure to deliver this premature baby by lower section cesarean section, and failure to use early CPAP and surfactant therapy after birth, and failure to prevent admission hypothermia, and the development of late onset sepsis after admission to the NICU. From the neonatologist's point of view, we could do something to help improve to reduce the mortality in our newborns by promoting use of early CPAP and surfactant therapy in these very preterm babies shortly after birth, and to prevent them from developing hypothermia before admission to the neonatal intensive care unit, and to prevent the occurrence of late onset sepsis in the neonatal intensive care units. According to the report, birth asphyxia is also a leading cause of death in newborns in Malaysia. Newborns with birth asphyxia usually develop hypoxic ischemic encephalopathy due to lack of oxygen, hypoxic, or restricted blood supply to the tissues, and then this results in damage to the brain, encephalopathy. This slide shows a flow diagram of the sequence of pathologic events triggered by hypoxic ischemia and culminating in brain injury. First, there will be primary failure in the tissue, energy failure, and then there will be a latent phase if no treatment is given, and secondary energy failure occur with more brain injury. And the pathological process during the primary energy failure are due to the release of glutamate, ionic imbalance, and then the outflow of the ionized calcium, lipases, proteases, and free radicals, causing injury and mitochondrial dysfunction. And if this process allowed to continue, It will lead to inflammation, cell death, apoptosis, oxidative injury, and decreased growth factor and decreased protein synthesis, leading more brain injury. So studies in animals and humans have found that if moderate hypothermia is applied during this latent phase, the secondary injury failure and further brain injury can be prevented. And this forms the basis of therapeutic hypothermia. During therapeutic hypothermia, the core body temperature of the babies is maintained in the moderate hypothermia range of 33 to 34 degrees centigrade within 6 hours of birth, and this temperature is maintained for 72 hours. After this, the baby is rewarmed slowly to normal body temperature. Both animal and human studies have shown that HIE newborns receiving therapeutic hypothermia have better survival and lower rates of cerebral palsy and cognitive impairment. The devices used for active therapeutic hypothermia are consist of either a cooling blanket or cooling cap. This slide shows the equipment used for active therapeutic hypothermia. This is the machine that will cool the liquid circulated to the cooling blanket to cool the baby, and the baby also has a rectal thermometer attached which feed back the temperature to the machine, and the machine will cool the liquid such to maintain the baby's body temperature stable between 33 to 34 degrees centigrade. We also often put the baby on the AEG to monitor the brain activity. This setup of machines are quite expensive, and the staff need to be trained properly to use it safely. A second method to provide therapeutic hypothermia is the passive method that's permitted by the Malaysian Clinical Practice Guideline. And this method consists of using cool gel pack and exposing the naked baby to the ambient temperature of the aircon and ICU. And the cool gel pack is a simple gel pack that we can purchase from the pharmacy. And the problem with this passive method is that it's difficult to maintain the core temperature constant between 33 to 34 degrees centigrade. And sometimes it takes quite a long time to cool the baby down to the moderate hypothermia range. In order to understand the cooling practices on HIE babies in Malaysian NICUs, since 2016, the Malaysian Neonatal Registry requested all member NICUs to submit data on both the type of cooling devices they use and also on all their babies with HIE. So we found that between 2016 to 2019, 45.5% of the NICUs did not have the proper set of equipment for active therapeutic hypothermia. Internationally, therapeutic hypothermia is recommended only for term and near-term babies with moderate or severe hypoxic ischemic encephalopathy. But during these 4 years, we found that some centers even use the proper machine to cool the baby with mild hypoxic ischemic encephalopathy. And some use the passive method. But those with moderate and severe hypoxic ischemic encephalopathy, only less 50% or less were cooled using the proper equipment. And 29% of the moderate and 22% of the severe HIE babies were cooled using the passive methods. when we analyze the risk factor associated with mortality in these HIE babies during this period, we found that those who received no therapeutic hypothermia have 4.7 times the higher risk of death when compared with those who were given the proper cooling method. And those who were giving the passive method have had 1.55 times the risk of death compared with those who were giving the proper method. And those babies who had moderate or severe HIE was also a significant risk factor associated with mortality. Our data provided clear evidence for the ministry to appreciate the importance of equipping all NICUs with proper cooling devices to help to reduce the mortality due to hypoxic ischemic encephalopathy. I'm glad to report that the ministry has approved budget to purchase cooling devices to all the NICUs now. Another group of conditions which we have studied using the data from the Malaysian Neonatal Registry is the neural tube defects. Neural tube defects are commonly caused by folic acid deficiency, and the incidence in many countries has been reduced by fortification of flour with folic acid. And the types of defects are very variable and can range from anencephaly to, that means no brain, to encephalocele, to spinal bifida with meningomyelocele. In 2009, we carried out an epidemiological study on the neural tube defect using data submitted by the 2 Malaysian hospitals in the network. And we found the prevalence of neural tube defect was 0.42 per thousand live births, being highest among the indigenous people of Sarawak and the lowest among Malaysians of Chinese descent. The most common type of neural tube defect was anencephaly, followed by spinal bifida and encephalocele. Majority of the infants were anencephaly, that's 94.5%, and 45.8% of with encephalocele, and 9.5% with spinal bifida died before discharge, and the median duration of hospital stay was 4 days. The findings of our study provides evidence for the Ministry of Health to promote fortification of flour with folic acid in Malaysia. So what are the challenges I faced during doing clinical research all these years? Well, I had limited time to conduct research due to my work commitment, as I was a full-time clinician and a full-time lecturer. And it was usually often time-consuming to recruit enough number of patients in the study for meaningful interpretation of research results. So it often took us 1 to 2 years to get adequate number of patients, so caused a lot of anxiety, and it also impact on our work schedule. And for clinical postgraduate students under my supervision, I need to identify logistically possible yet meaningful research topics for them. And we often face financial constraints. And initially, I did not have much skill in design, research, writing manuscript for publication. And however, I acquired this gradually on the job. I received some formal training in research and publications by attending some short courses. Most of my training was informal, learning from collaborators, colleagues, external examiners of my postgraduate students, journal reviewers, and my students. I help myself to improve the standard of my English language and statistical methods through reading. My husband helped me a lot. In the 1980s, he bought me a computer so that I could do my work and analysis using the computer well before the university provided us computers to do our work. He influenced my mindset to appreciate the importance of sacrificing time and money on research for a good cause and to handle rejection of manuscripts by some journal editors. There are two important factors which motivated me in doing research all these years. One is my compulsion to identify modifying factors to improve quality of care and to solve clinical problems, and my desire to improve both the survival and quality of life for my patients. I believe the survivor should have good brain, good eye, good hearing, good lungs, and good gut. Thank you for listening.
Thank you, Professor Bu, for your excellent talk and interesting sharing of your 40 years journey in carrying out clinical research on various disease conditions affecting newborn infants in Malaysia. Your significant research findings have played an important role in improving the quality of newborn care and the survival and quality of life of high-risk babies. Congratulations again, Professor Bu, for winning the MINDS 2023 Outstanding Woman Scientist Lifetime Scientific Research Achievement Award. Ladies and gentlemen, we will now commence the section 1 of the conference. There are 3 papers in these sections to be presented by eminent scientists covering the topics of avian, veterinary, economics, and stem cells. Each speaker will be given 20 minutes and all Q&A will be taken together at the end of section 1. Ladies and gentlemen, our first speaker of this section is Professor Dr. Jalila Abu. Professor is a clinical professor in avian medicine and surgery, as well as the current Deputy Dean of Academic and Student Affairs, Faculty of Veterinary Medicine, University Putra, Malaysia. She obtained her PhD in avian surgery from the University of Minnesota, USA. Her main research interests are in the areas of avian medicine and surgery, particularly in avian orthopedic, bone grafting, and infectious disease in birds. The outcome of her research findings has culminated in more than 84 papers being published in international reputable journals. Professor Jalila is an avian consultant actively involved in clinical services and a referral avian consultant for Malaysia and at the international level, especially in the educational program. She is the current president of UPM academic staff and the Malaysian representative to the European Associations of Avian Veterinarians. Ladies and gentlemen, please join me in welcoming Professor Dr. Jalila Abu. The title of Professor's talk is Avian Veterinarians, My Adventure with Pet Birds and Wild Birds. Thank you very much.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh and very good morning everyone. My name is Prof. Dr. Jalila Abu from Faculty of Veterinary Medicine, University Putra, Malaysia. And today I'm going to share my presentation and my experience with birds, and the title for my presentation is Avian Veterinarian, My Adventure with Pet Birds and Wild Birds. First of all, I would like to thank to the organizing committee, the MINDS team for this invitation. It is my great pleasure to be here today. There are so many different avian species. As you can see here, a beautiful blue and gold macaw. One of the common bird species that is important is raptors or birds of prey. Cetacean, there are various sizes and it is very colorful birds. It's not native to our country, but many people keep it as a pet. and also breed them. In some park, they bought a various species of exotic wetland birds and keep it in the aviary or release it in the water, open water, and some species that native to our country also. Even medicine is the sign of practice of diagnosis, treatment, and prevention of disease. There are so many different books that is important for even veterinarian to seek for the knowledge for practice, as well for the public and other people that are interested to know more about birds. Most common avian species submitted to the avian vet, to the vet clinics or to the veterinary hospital, such as the species that I mentioned just now, citizen birds, birds of prey, wetland birds, and other species. The size varies as tiny as finches or a larger bird such as eagle, macaw, or an ostrich. So this is just a photo of a small bee-eater, a tiny bird, maybe about 15 to 20 grams, and a large size of ostrich. So avian veterinarian is a veterinarian who specializes in treating birds. All veterinarian upon first qualification from a certified veterinary college may treat any species. Additional training is required for qualification to become a recognized specialist in the care of birds. So this is the green bird. This is one of the bird named Mocha, and it recover and in good health. So this is one of the photo when the owner WhatsApp me and share about Mocha already fully recovered. And you can see that in the left photo showing a tiny bird, a budgies, and it's at the same color as my lab coat. They are so cute. So as for vet, we need to know the importance of beak and feet topography. It is important for us about this matter because it is important to know which capture and restraint techniques to use. And you can see that there are various sizes, various beak deformity and shape, so that it tells us what type of diet that we need to give to the bird when we put them in the ward or use them for continued rehabilitation when the injury is quite severe. So this is some photo of capture and restraining technique, especially for citizen species, because of the bill and the talon is important. So we have to use a special citizen technique. And on your right, it is various technique we call body grab technique, especially when we deal with some small bird as well as bigger size bird. For example, when we deal with raptors, we have to protect ourselves by using a special glove or using any glove that important to protect our hand. In our practice or avian veterinarian, one of the common techniques is grooming technique, especially when the bird in captivity, we have to check their bill as well as their talon. So this is a photo where a procedure where beak trimming was conducted, and also the other one is the jaw, where is the important place when you do the trimming, so that you prevent from the injury too deep and then can cause bleeding and painful to the bird. This photo or slide showing basic procedure when dealing with avian patient. For example, how to collect blood, how to handle them for X-ray positioning. And also you can see that in the photo on the bottom is one of the bird, a kite, with a bandage on the wing to show that this bird have a problem with the wing. And at the same time, eye examination is important for raptors because when they get injury or head trauma, they may have a fundus abnormalities or bleeding in the eyes, then as a result cause permanent eye injury, and they cannot go back, we cannot send them back to the wild. So for your information, general anesthesia, it is one of the techniques that we apply in birds because they need that for, to reduce the painful when you want to conduct any specific surgery or to evaluate them further for further diagnostic. So you can see that on your right is a photo of a budgies with a small cone, and on your left is a medium-sized bird where we put a mask to put through the anesthetic medicine, then the bird will be under general anesthesia or sedate. So since my topic is about the adventures of working with pet birds and wild birds, so here I want to share various cases that may be interesting for everyone to show that maybe the difficulties or maybe an interesting journey when we deal with birds. So the first one is about a binding problem. This is a goose, a white goose with the problem of difficulty in laying an eggs. So we call them egg binding problem. So you can see that on the left is a photo of distension of the end of the abdomen part, or we call it at the cloaca region. And on your right is a photo of a goose where we already conducted the manual removal of the eggs during the visit to the hospital. So of course, prior to that, we did an X-ray, and you can see that there are 3 eggs in the reproductive tract of a bird, and as well as in the cloaca region. So this case is about a minor with the eye mass on the right eye, and you can see that the left eye is normal. So what we did is, for this case, we have to do minor surgery to have a little cut under general anesthesia, and you can see that this is the preparation for the surgery. This one, just a sharing about an Amazon parrot with depression. You can see that it's so depressed, and on your right side to show that after giving a treatment and the bird getting better, and it looks so bright and alert. So another one is a case of tumor. It is lipoma or skin tumor in a cockatoo, white bird. Then you can see that, of course, when we want to remove the mass, we have to put the bird under general anesthesia, and then to examine properly the surgery site, and we have to prepare at the fractures, at the wound, at the growth area for the surgery. So this photo show that after the surgery already conducted, and then application of antibiotic at the suture site, and as well as still monitoring the bird to make sure that the bird is still stable and survive, and then followed by the process of recovery. And this is another case of distended abdomen in a macaw. You can see that on the left side, you can see the distal end of the body or abdomen showing distension. And then on your right, to show that this bird, during the preparation for the surgery, the area for the exploratory. So this slide is showing a bumblefoot in a water bird. So this is one of the common problems, especially when we deal with water birds such as swan, a pelican, where it has shown here abnormality of the metatarsal pad, where you can see that the bird will have problem in walking and it's painful. So we have to clean the wound, check how severe the area, then either we need to conduct medical management for the case, or maybe in some cases we have to proceed with the surgery. So this slide showing a fractured leg in a tiny bird. So this bird involved with trauma to the fan. It flew towards the fan, and then it had 2 broken legs. And this, you can see that in smaller bird, we cannot, it's a bit difficult to do a surgery in tiny bird, but of course, there are techniques that we can use, such as tape splint technique, for example, in this case. Robert Jones bandaging techniques. This is one of the techniques that we apply, bandaging technique in birds, and it is important, especially for bigger size birds. Okay, now I'm going to share a bit on the external coaptation stabilization of right closed ulnar fracture in a great white pelican. This is one of the old case where we received a pelican, a huge bird, maybe about 4 to 5 kilograms. And of course, it is important when we restrain the bird because of the bill is huge. And of course, the wing, first thing that we need to get a proper technical person to handle the bird. Then later, as a vet, we have to palpate where the fracture, for example, in this photo, and then we need to position the bird for the x-ray so that we can look at which bone that affected, then how to conduct a bandage afterwards or what kind of bandaging technique that we can choose. So this is a photo of an x-ray of this pelican on your left side to show that a normal fracture, a normal bone of a bird, okay? And if you look at on your right-hand side, the orange marking is the place where it is a fracture of the long bone. And at this moment, because of the bone is quite near to each other, we decided to proceed with the external coaptation or bandaging technique for this pelican. So this, you can see that this is the pelican with the bone fracture of the wing, and this is a figure of eight bandage technique for the bird. In some cases with fracture, we use surgical techniques, especially in a case where the fracture is so severe and then the alignment of the bone is very crucial. So this is an example of fracture repair in an owl. This is intra-operative where you can see on your left if the bird when we positioning for the x-ray on the right side is the position of the pin and the fracture site so that the surgeon able to look at the position of the alignment of the bone as well as the position of the pin in the bone in the bird. So of course, when we want to conduct the surgery, the bird will put under general anesthesia. This is a special procedure for general case for surgery. And then this is to show during the surgery, after we suture the skin and check the position of the pin in the bone and the alignment of the bone through the x-ray. And then this just to show a photo how we apply external bar is a lightweight bar to support the whole pin in the bone of this bird, and at the end application of the figure of eight bandage to support the wing for a couple of days while the bird trying to accommodate with the presence of the pin in the bone. So in raptors, one of the important technique is imping feathers. This is, we apply this technique especially in a bird with damaged primary feathers. Primary feathers is important, especially for wild bird. For them to release back to the wild, they need to have a perfect primary feathers so that they can fly in the wild and also able to hunt. So this is just to share that we need to get the feathers from other bird, maybe some bird that rescued and then they cannot release back to the wild because of the injury, or maybe some bird that come in die during examination, or maybe found dead at the roadside. So we have to save some of these feathers so that we can imping it in a bird of difference of the same species. Okay, so beside my clinical exposure here, I would like to show sharing a bit on the education of my specialty. Even medicine and surgery is already used or in the doctor of veterinary medicine curriculum, as well as for undergraduate and graduate program. And rehabilitation and conservation work, especially for raptors, is ongoing with my research members or with the association. Continuing education training for veterinarian in our country and international, and also my interest in research in avian medicine and surgery. So for student training, of course, for first time or maybe for the first year student, normally I bring them to visit various bird park for them to get the knowledge about different species of bird. And then when they will be in clinical years, then they will see the case right in front of their eyes, experience it, and they will practice in this section. And at a certain time with the student club, involve them with bird watching activities to instill or inspire them to involve in any association, not just to treat birds, but also the roles of veterinarian in conservation. So networking, there are so many networking, such as with the Asian Raptor Research Conservation Network team, where my contribution in sharing my knowledge on avian orthopedic, or maybe various workshops to educate some of the vets from different countries. Knowledge sharing through seminar, especially during COVID. We share the knowledge through seminars so that we can share the information about what happened when we found an injured bird, or maybe a special seminar for veterinarian. Knowledge sharing for Raptor Watch, especially during the Raptor Watch every year. I hope everyone aware about Raptor Watch every early of March every year regarding raptor migration. So this is a place where public, student, veterinarian, they can gather here and be there for this program. And through my knowledge, experience, also involved with the various platforms such as workshop, as plenary speaker or invited speaker, or maybe I'm also as a student in various seminar. Knowledge sharing through Asian Raptor research in different countries. My objective normally when I was invited to different countries, at the same time, I must get a platform where I can see the student sharing through seminar or maybe a special workshop for the student, so that I know from that contribution, they will be the future manpower to share and apply the techniques. For example, in Mongolia, Ulaanbaatar, knowledge sharing for Indonesian group through university and also association, Bali, Bogor, University of Bogor, University Udayana Bali, Jakarta, University Gajah Mada. So this is one of the example where I was invited for the workshop for even veterinarian as well as for student at Bogor University. And then this is during my visit to the Chittagong Veterinary and Animal Science University, where I got the opportunity to share my experience with students. Knowledge sharing in India, I was 1 week at the Guru Anand Dev Veterinary and Animal Science University, where this is a platform sharing and on avian medicine and surgery, orthopedics with the vet student as well as the graduate student and the lecturers at the university. Of course, if in my objective when dealing with wild birds, the most important is to release them back to the wild. And for the bird that owner with them, normally we make sure that the bird is healthy and they go back to the owner. So in conclusion, as my journey an avian veterinarian since I'm a tutor in 1996, and then further study for my further study for PhD and residency program at University of Minnesota, and back home from 2002, and then now I'm here at University Putra Malaysia. The adventures with pet birds and wild birds will continue to serve my expertise and to share my experience to fulfill my lifelong commitment to make a difference. Before I end, I would like to thank to all my mentors in avian medicine and surgery, Prof. Larry J. Wallace, Pat Reddick, Prof. Datin Paduka, Aini Idris, my MNS Malaysian Nature Society team, Asian Raptor Research Group, and also UPM Avian Exotic team, the veterinarian as well as technical staff that around me when we're dealing with avian cases. The Raptor Center Clinic staff this is a very old photo in 2001, and it is a place where where I received my knowledge and gain the knowledge for me to serve our country as well as different country. And this is just example of the rector release in 2017, where Prof. Reddick is the founder and the veterinarian at the University of Minnesota, my supervisor and my mentors also. And at the end, I would like to thank you to everyone. And I hope my sharing today able to give more knowledge and information, and also motivate others to be in a veterinarian or career as a veterinarian for the future. Thank you very much and have a great day.
Thank you, Professor Jalila, for your excellent presentations. Our next speaker is Professor Dr. Evelyn S. Devadesan. Professor is at the Faculty of Business and Economics, University of Malaya, and Vice President of the Malaysian Economic Association. She received her PhD and Master, both specializing in economics from University of Malaya in 1996 and the National University of Singapore in 1992 respectively. Her research focuses on international trade and regional integrations. She published widely and has more than 100 journal papers, books, and book chapters to her credit. She currently serves as the Editor-in-Chief of the Institutions and Economics Journal, Associate Editor of the International Journal of Social Economics, and member of the editorial boards of the Journal of Contemporary Asia and International Journal of Rural Management. She has been engaged as a consultant in several international research projects, namely the International Confederations of Free Trade Unions and Asia and Pacific Regional Organization Joint Project, among others. Today, she will speak on the beauty of economics, new thinking and research in international trade. It is now my pleasure to invite Professor Dr. Evelyn S. Devadesan to deliver her presentation. Professor, the floor is yours. Thank you very much.
Good morning, everyone. I would like to express my sincere thanks to the Malaysian Invention and Design Society MINDS for this kind invitation to share my thoughts on the beauty of the economics discipline with specific reference to the subject on international trade. Economics comes with plenty of criticisms. We may be familiar with some of these accusations as shown on the slide, one of which is that economic models are based on assumptions to simplify the models. As such, critics argue that assumptions in any economic model are unrealistic and often don't hold up in the real world. If we recall, in the aftermath of the global financial crisis, economic forecasting, more specifically, had come under heavy criticism for its inability to predict the crisis. The crisis was therefore not just deemed a crisis for the global economy, but a crisis of economic thinking. Given the limitations of theoretical models, there is immense pressure for the mainstream paradigm in economics to take on an to multidisciplinary approach. One example that we may be familiar with is behavioral economics, which is gaining greater appreciation today. Behavioral economics seeks to understand economic behavior by incorporating insights from psychology, cognitive sciences, and sociology. Having said that, economics today has somewhat changed. Even the research has evolved. Hence, we need to move on with the criticisms leveled against this discipline. Indeed, economists continue to face the daunting task of persuading people that what they argue and predict is true. However, I would like to argue here that the beauty of economics lies in three aspects. One, the extensive use of mathematics and the manipulation of statistical data to test theory and establish empirical evidence. Two, the use of theory to build models and explain the real-world phenomena, and 3, the economic analysis that ultimately turn theoretical models into useful tools for policy and decision-making. We would have heard some recent developments in terms of decision-making using randomized controlled trials or RCTs for impact evaluation of a specific program or policy intervention. To explain how the theories and models in the economics discipline have evolved over time while appreciating the beauty of this discipline, I will make specific reference to the subject on international trade, which is also my area of research. Traditional or old theories of international trade explain the flow of goods between countries in terms of comparative advantage, which is based on differences in opportunity costs of production, and this modifies the earlier principle of absolute advantage. Now, a key implication of traditional theories is that inter-industry trade is dominant, that is, trade takes place between different industries. The fact that a larger share of global trade takes place within similar industries, what is termed as intra-industry trade, and between similar and not different countries, led to the creation of new trade theories linked to Paul Krugman 1980, Elhanan Helpman 1981, and William Athier 1982, among others, to explain these trade flows based on economies of scale and consumer preferences for variety. Subsequently, in the mid-1990s, there was a surge in several empirical studies providing a wealth of information about the important role that firms instead of countries play in driving trade. You would have heard that it is firms that trade and not countries that trade. This research, emphasizing the importance of firm heterogeneity, became possible with the availability of micro-rich data sets that tracks trade at the firm level. Following such developments in trade theories and economic models, the modeling approaches in the literature have also expanded with the availability of micro or firm level data sets. In fact, the pure theory of international trade is a subset of general equilibrium theory, one of the areas of economics where beauty has been remarked upon. It is this set of general equilibrium models of the world economy where the world comprises a number of countries that trade goods and factors among each other that are popularly used to analyze trade policy and trade shocks. Today, where trade consists of complex supply chains and relationships between countries, in fact, if you are familiar, global trade, or about 70% of global trade, is dictated by supply chains. New tools have emerged, such as network analysis, that is used to shed light on questions related to the importance or centrality or the relationship between different communities or countries, known as community detection. It is evident that the theories, models, and economic techniques have evolved substantially to explain new drivers of trade. The research is therefore dynamic to explain the evolving trade patterns as observed in the real world. For example, trade has been for long recognized as a channel for technology spillovers, and today, with external shocks, the focal point of research is on trade as a channel for the transmission of those shocks. On this slide, you will note several pictures on your left that reflect these shocks since the turn of the 21st century, beginning with the global financial crisis, the US-China trade war, the COVID-19 pandemic, and the Russia-Ukraine war. Aside from the pandemic, which is inherently a global health issue, the other three remaining shocks, that is the US-China trade war, the global financial crisis, and the Russia-Ukraine war, are transmitted globally beyond the countries involved, either directly or indirectly through trade, as countries have become integrated through supply chains. The reality is that trade is indeed multifaceted. Services are bundled with trade in goods, as services are the enablers of global supply chains. And today, with the rise of digital trade, including e-commerce, data flows have now become bundled with tangible or physical trade. Hence, the supply chain is evolving from having a functional orientation to a global interconnected network of data and processes, as shown in the diagram of this slide. Beyond trade patterns, we also see shifts in trade policies with the rise of technical measures such as sanitary and phytosanitary measures and technical barriers to trade, which has now become known as non-tariff measures. These non-tariff measures are driven by non-trade policy objectives such as human health, environmental protection, and national security. And countries globally are increasingly regulating trade with these measures. We also see the proliferation of deep agreements that have binding provisions and link trade with labor and environment, as issues such as sustainable trade and green trade are gaining a strong foothold globally. The multifaceted reality of trade, in turn, prompts new thinking and new research to understand, explain, and inform the debate on contemporary issues shaping global trade. The economic style of reasoning, where econometric tools, or rather making numbers speak to examine a problem, previously had a narrow focus on markets and efficiency, but now it has broadened as policy domains become inherently marked by the interplay of evidence and desired actions that can address societal challenges and maximize the net benefits to society. For example, the focus on sustainable trade. Sustainable trade could refer to addressing labor rights, human rights, to prevent the loss of biodiversity, and the focus on greening trade to reduce carbon emissions, for example, are all important to society. In terms of new ways of thinking about policy, let us take the case of supply chains. The linear logic of supply chains that we are familiar with and that was shown in the earlier slide, that is from upstream sourcing of components to the distribution of final products, in fact no longer holds today. As shown previously, supply chains are now being re-architected as ecosystems coordinated by central platforms where data becomes centric to the entire ecosystem. Digitized supply chains therefore not only trigger new business models, but they also require better coordination in data flows across borders. This calls for a new framework for analyzing digital trade, starting from the basics or fundamentals of defining and measuring digital trade, identifying digital trade enablers, to broader issues such as framing policies to ensure the interoperability of digital frameworks, not just across borders but within borders, and also for considering different platforms or trade agreements for addressing these digital trade rules. Hence, it's without a doubt that economic research generates a wide array of benefits. These include information to reframe debates and shape policy. It is also impactful in that it benefits all economic agents, the industry, the state, and the society. For example, studies on trade facilitation and global value chains or global supply chains provide the input for companies to build stronger and resilient supply chains. policy evaluations, and predictions on market access, trade creation, and welfare gains are useful to guide policymakers on whether they should engage in deep free trade agreements with binding provisions. Finally, the shift towards sustainable trade, as shown in the picture, there are 17 sustainable development goals, can lead to improved well-being. I hope this short presentation would have helped you appreciate the beauty in economics, beginning with how we qualify economics from the point of view of aesthetics, to the specific reference in international trade, where we see how trade theories and their applications have evolved over time, how global shifts and domestic shifts have redefined the extent of trade, what are the new ways of thinking and problems, causal assumption and approaches to methodology which are not robust to time or even location, and they can be subject to empirical verification or rejection. So there's a lot of dynamism in the way the modeling approaches are done. And finally, how impactful the research is to all quarters in the society. Finally, before I end my presentation, I would like to quickly remark on the career prospects of studying economics, as I made to understand that the attendees of this conference include students among others. Studying economics definitely will prepare you, or rather is a path for a career as an economist, be in academia, where you will specialize in one or two research areas, such as international economics, labor economics, environmental economics, and etc. Or you will work in the government and industry. For those who stop with a basic degree in economics, studying economics helps you cultivate skills that are essential, such as numeracy skills, data analysis, research skills that will be sought after by employers in diverse fields. Thank you for your attention, and I'll be happy to take on questions at the end of the session.
Thank you, Professor Dr. Evelyn, for your excellent and insightful presentations. Our final speaker for Section 1 is Professor Dr. Rebecca Wong Shin Yi. Prof. Wong is currently a professor of physiology and head of preclinical sciences at the Faculty of Medicine, Health Sciences and Nursing, Sagi University. She's also a registered medical practitioner of the Malaysian Medical Council. Her research interests include cancer, stem cells, and medical educations. She has numerous publications in high-impact international journals, and her published works have been cited widely by researchers worldwide. She was listed among the world's top 2% most cited scientists for 3 consecutive years, 2020, 2021, and 2022 by Stanford University. Prof. Wong has also been awarded with many national and international accolades. This includes, among others, the Asia's Most Influential 2020 list for healthcare and sciences by Tatler Malaysia, winner of the prestigious 10 Outstanding Young Malaysian Award for the Academic Leadership and Accomplishments category, and winner of the Malaysia Most Impactful Young Educator Award 2019. Today, Prof. Wong will speak to us on the stem cells, current knowledge and future perspective. Ladies and gentlemen, please welcome Professor Rebecca Wong. Thank you very much.
A very good morning to the President of MINDS, Yang Bahagia Academician Emeritus Professor Tan Sri Datuk Dr. Augustine Ong Sun Hock, the Chairperson Yang Bahagia Datuk Dr. Chu Yuan Mei, Professors, Doctors, ladies and gentlemen, and all participants of National Conference on Contributions to National Development by Malaysian Women Scientists and Inventors 2023. Thank you for having me here today. The title of my presentation today is mesenchymal stem cell research and therapy, current knowledge and future perspectives. My name is Rebecca Wong. I'm a professor of physiology and the head of preclinical sciences at the Faculty of Medicine, Nursing and Health Sciences, Sagi University. My talk today will be divided into three main parts. In the first part, I will give you an overview of mesenchymal stem cells. I will talk about what they are, where we can find them, their properties and therapeutic effects, as well as their applications. In the second part, I will talk about the current trends and challenges in MSc research and therapy. Here, I will talk about the focus areas and medical conditions in which MSCs are involved in clinical studies and the challenges in MSc research at various stages. The last part, I will talk about future perspectives. Here, I will talk about cell-free alternatives. Now let's start with an overview of mesenchymal stem cells. In order to understand mesenchymal stem cells, we must understand some properties of a stem cell. So a stem cell has two main properties. The first one is the ability to self-renew. This means that a cell can replicate itself or make copies of itself. The second property of a stem cell is the ability to differentiate. This means that the cell can change from a non-specialized cell to a cell that is more specialized, and this process is known as differentiation. So, what are mesenchymal stem cells? These cells are found in the adult bone marrow, and we know that in the bone marrow we have two main types of stem cells, the hematopoietic stem cells as well as the non-hematopoietic stem cells. So MSCs belong to the non-hematopoietic stem cells. They are multipotent cells and they are capable of self-renewal. These cells can differentiate into various tissues of mesodermal origin, and some examples are bone, cartilage, tendon, adipose tissue, heart, muscle, and marrow stroma. Now, how do we identify mesenchymal stem cells? There are some positive markers and negative markers used for the identification of mesenchymal stem cells. So in the lab, if we would like to find out whether a cell is an MSC, we can look for the presence or absence of these markers. And of course, these cells, like any other stem cell, are capable of self-renewal. And another way to identify MSCs is by looking at their differentiation potential. So one of the criteria to identify MSCs is to look at whether they can differentiate into osteoblasts, adipocytes, chondrocytes, and other cells of mesodermal origin. So where can we find mesenchymal stem cells? In the previous slide, I have mentioned that we can find mesenchymal stem cells in the bone marrow. However, we can also find the cells in other tissues or locations like adipose tissues, placenta, amniotic fluid or tissue, dental tissue, umbilical cord or Wharton's jelly. So these are some of the places where we can find mesenchymal stem cells. So why are mesenchymal stem cells so popular among researchers and scientists? One of the reasons is that they can be found in multiple locations in the body. As I've mentioned, we can find them in the bone marrow, adipose tissue, peripheral blood, umbilical cord blood, amniotic tissue, placenta, and so on. And these cells are relatively easy to harvest. After that, they are relatively easy to be cultured in the lab. even though they have limited lifespan in culture, but they are relatively easy to culture compared to other types of stem cells. Another advantage of using mesenchymal stem cells in research and therapy is that they are multipotent, so they can differentiate into different types of specialized cells, such as osteoblasts, adipocytes, and chondrocytes. Besides, mesenchymal stem cells have immunosuppressive effects, and they can be used both as autograft and allograft. So these are some of the reasons why mesenchymal stem cells are popular among researchers and clinicians. Now, when talking about the differentiation potential of MSCs, we know that these cells can differentiate into cells of mesodermal origin, such as adipocytes, chondrocytes, and osteoblasts. However, we also know that they can transdifferentiate into cells of ectodermal and endodermal origin, and some examples of these cells are neurons, hepatocytes, and beta cells of the pancreas. So instead of differentiating into cells of one germ layer, they can actually differentiate into cells of all three germ layers. That's why mesenchymal stem cells have a lot of therapeutic potential. The therapeutic effects of MSCs have been well studied. We know that MSCs exert several beneficial effects in the body, such as anti-inflammatory effects, immunomodulatory effects, anti-apoptotic effects, anti-fibrotic effects, and they also help in improving angiogenesis. They are also very helpful in tissue repair and regeneration, and they are capable of differentiating into cells of multiple tissues, such as bone, cartilage, and adipose tissue. Therefore, they have been applied in many medical conditions. For example, they have been used in autoimmune diseases such as rheumatoid arthritis and inflammatory bowel disease. They have also been used to improve angiogenesis or new vessel formation, such as in cardiovascular diseases and many other types of medical conditions. Besides their multipotent differentiation potential, which allows MSCs to differentiate into many types of cells, MSC also has the ability to move toward sites of injury and inflammation. And this is a very important property of MSCs because it allows MSCs to move to sites where repair and regeneration are needed. MSCs also interact with various immune cells and exert their immunosuppressive and immunomodulatory effects. Besides, MSCs also secrete many soluble factors such as cytokines, chemokines, growth factors, and so on, and exert their trophic effects on tissue repair and regeneration. In short, MSCs can be obtained from multiple sources, and they have many therapeutic effects. They have been applied in many medical conditions, such as conditions of the liver, respiratory problems, osteoporosis and osteoarthritis, diseases of the cardiovascular system, kidney diseases, and neurological conditions, and they are also very helpful in wound healing. Next, we are going to talk about the current trends and challenges in MSC research and therapy. The number of clinical trials on MSCs is growing at exponential speed, and various types of MSCs from different tissues have been used. And the commonest types are bone marrow-derived mesenchymal stem cells, umbilical cord-derived mesenchymal stem cells, and adipose tissue-derived mesenchymal stem cells. This diagram shows the key focus areas in MSc research, such as the proof of concept type of research, where the cell heterogeneity, cell identity, and genome editing are studied. Other areas of research include the mechanisms of action of MSCs, as well as the culture conditions and cell manufacturing of MSCs. And one of the key success in MSC therapy is the large-scale production of high-quality cell products for injections and for therapeutic purpose. The diagram on the left shows the different routes of administration for MSCs. In the published literature, several routes of administration have been reported. This includes surface application or topical application, intravenous, subcutaneous, intracardial, intraperitoneal, as well as intra-articular injections. And the route of administration depends on the type of disease involved. For example, intra-articular injections are common in joint diseases, and surface or topical application is common in skin diseases. The pie chart on the right shows the different specialties or disease categories involved in MSc research, and the top 5 are diseases involving the musculoskeletal system, neurological conditions, conditions involving the lungs or the respiratory system, such as COVID-19, immunological conditions, as well as cardiovascular conditions. This slide shows the number of clinical trials by country. As the number of clinical trials on MSCs increases, the number of countries that are involved in MSc research also increases. The top 5 countries, as shown in this slide, are China, the United States, South Korea, Spain, and Iran. And many other countries are also involved in MSc research. Although there are many advantages for using MSCs in research and therapy, researchers face several challenges, and one common problem is the heterogeneity of MSCs at multiple levels, and this can be affected by donor factors such as the health status, genetics, gender, and age. Besides, MSCs derived from different tissues or sources exhibit different characteristics. The functional characteristics of MSCs are also affected by factors like cell isolation techniques, cell culture environment, as well as the preservation conditions. The therapeutic effects of MSCs can also be affected by the administration route, injection site, infusion time, and cell carrier materials. Researchers also face the challenge of immune incompatibility between donors and recipients when allografts are used. Besides, the complex effective components released by MSCs depend on the host microenvironment, such as inflammation status, hypoxia, and extracellular matrix. All these factors can affect the functions of MSCs. This is the third and last part of my presentation today, and I'm going to talk about the future trends in MSc research and therapy. In the previous part of my talk, I've talked about the challenges faced by researchers and clinicians in the use of MSCs in research and therapy, and one of the challenges due to the differences in MSCs from different donors culture environments, as well as different sources. So to overcome this challenge, researchers have looked into cell-free alternatives, and secretome of MSCs is a cell-free alternative that is very popular now in research. The MSC secretome consists of soluble factors, and these include things like cytokines like interleukin, tumor necrosis factor alpha, chemokines, growth factors such as hepatocyte growth factor and transforming growth factor beta, and extracellular vesicles. And this consists of exosomes and microvesicles. This slide shows the secretome of MSCs. The secretome is defined as the set of substances released from the cell to their surroundings with a wide spectrum of biological actions. And the MSC secretome consists of the soluble factors as well as the vesicular fraction. So this is the soluble fraction, and here we have the chemokines, cytokines, growth factors, hormones, RNAs, microRNAs, and so on and so forth. In the vesicular fraction, we have the exosomes, the microvesicles, and the larger extracellular vesicles. So all these components collectively make up the secretome of MSCs. There are many advantages of using MSC cell-free alternatives in research and therapy. Besides avoid the use of whole cells, we also have the advantage of priming the MSCs, and this priming will allow MSCs to make the soluble factors or substances which are desired for a particular medical condition. There are four main ways to manipulate the secretome by priming method. We can use pharmacological or chemical agents to prime the cells. We can treat the cells with different cytokines. We can use 3D cultures and bioscaffolds to culture the cells, or induce the cells under hypoxic conditions. And all these methods can help us to prime the cells to get the desired effects or secretome or secretory products which are used in different medical conditions. Another way of manipulating the MSC secretome is by genetic engineering. Using this method, we can make the MSCs express or overexpress specific proteins, microRNA, by a targeted RNA or DNA transfer. And this can be done using a viral or viral vector method, or we can use a non-viral method through various biological, chemical, physical approaches. In conclusion, the number of clinical studies on MSCs is increasing over the past few decades. MSCs and their derivatives are very promising therapeutic candidates in many conditions, owing to their numerous beneficial effects. Although there are many advantages of using MSCs, challenges exist in MSC research and therapy, such as the heterogeneity of MSCs at various levels of preparation and application, as well as a lack of standardization in many protocols. So future research can include improvement in bioprocessing of MSCs, improvement in cell culture products, better expansion methods, standardization in culture sources of MSC use, administration routes, compliance with GMP, good manufacturing practice, as well as the use of cell-free alternatives such as the secretome of MSCs. In all these applications, the development of a robust and scalable manufacturing process is necessary. These are the references used in my presentation. Thank you for listening to my talk and have a nice day.
Thank you very much, Professor Dr. Rebecca. So now we are going for the Q&A section. We received quite a lot of the questions from the delegates and audience. The first questions is by Tan Sri Datuk Dr. Augustine Ong, addressed to Emeritus Professor Dr. Pu. The question is, please name some of the centers of excellence in your area, for example, in UK.
Thank you, Tan Sri, for the question. Center of Excellence in UK. Sorry, I offhand I can't tell you because I haven't been practicing in UK for many years. I think now 40 years. So I haven't been keeping in touch with the listing of the Center of Excellence. I'm sorry about that. I shall look up and let you know.
Oh, is there any Center of Excellence you are aware of you can share?
You mean Center of Excellence or neonatology or?
Yeah, in your area.
In my area, honestly, I haven't been keeping in touch with that, you know. Usually my contact is mainly with the Australians and in the region, like Singapore and Hong Kong.
Yeah. You can share some of the center in Singapore, Hong Kong?
This Singapore is the KK Hospital, because they handle lots of, they are the referral center, and also the NUS neonatal center. And then Hong Kong, there's of course the Hong Kong University. I think it's the Mary Hospital, and also the Chinese University of Hong Kong. Yes.
Thank you very much. So question 2 is from Tan Sri Datuk Dr. Augustine Ong to Professor Dr. Jalila Abu. What's the status of the our population in Malaysia?
Thank you, Tan Sri, and to all. For your information, I mean, the data for the status of Ban Au normally, I mean, if you refer to conservation status, the Ban Au, we didn't, specifically counted the numbers in a while. Is pretty difficult, but of course, it's considered under a common species. It's not at the level of extinction or threatened. But of course, these species they are protected species, and it is a common. I mean, it's abundance in our country, and the population of the Ban Au is important, especially in the agriculture, as a biological control. It gives a, very good impact to the agriculture in controlling rodent in paddy fields, oil palm plantation, and others.
Interesting, for paddy field.
Yeah.
Question 3 from Dr. Lee Chen Sing to Professor Dr. Evelyn. What is your view on the metaverse?
Thank you, Prof. Lee, for the question. Firstly, I think I would start by saying metaverse in itself is a rather big concept, but if I were to link metaverse with trade, I'm not very much familiar with metaverse, but let me take the example of blockchain technology in developing metaverse, because I've seen the physical part of blockchain technology, which has expanded, especially in the case of Indonesia, when you talk about customs interacting, the port operators, the consumers, the firms, and the financial sector, the financial providers. So if we talk about it in a spatial context, yeah, metaverse, I would think that it may be the next frontier of free market, yeah, and blockchain technology. If I were to refer to blockchain technology being main as a context for mainstreaming this, I think we can see greater data flows. We can see better integration with the world economy, because today we also talk about digital assets, right? Going hand in hand with digital trade. But then again, I would draw caution to this in terms of regulating such trade, because I can't imagine in the sense like how the data will flow, antitrust laws, things like security and so on. So I think it would be eventually the way in which countries will head. And I know blockchain technology in mainstreaming metaverse, its development is still at an early stage, but we would eventually see this. I hope my answer answers your question. Thank you so much.
Yeah, there are a lot of potential for this area. Okay, question 4 from Tan Sri Dato Dr. Augustine Ong to Professor Rebecca Wong. So what is your comment on the unfair measure used in free trade? For instance, the anti-palm oil campaigns or any other campaigns you are aware of?
I think this question is for another speaker, because my talk is on stem cells. I suppose this is on the trade, the talk on economics. The speaker before me.
And any of you would like to answer these questions? Or in your area, any unfair measure in your area?
Prof, if I may chip in here, I'm familiar a bit on the palm oil. It's an ongoing issue. In fact, only yesterday we had on the EU Green Deal, which is coming on board. Yeah, so one hand, we say it's unfair to, they claim there is still deforestation. They claim that we have not complied with the RSPO, while we have a Malaysia Sustainable Palm Oil Practices. So it's very much debatable, subjective, and still under negotiation whether the EU will accept our MSPO. So when we talk about unfair measures, today we talk about a fair level playing field, right? Instead of just free trade, it's fair trade. So fair trade is when you link trade with labor and environment. This is where we see fair trade. So it's just not a palm oil issue, it's also labor rights, right? Some countries may argue that, like in the case of Sabah and Sarawak, they use child labor. They consider it as child labor working in the plantation. But then when you look at child labor, it's how you redefine child labor. ILO has its own definition. Malaysia says that they have their own definition because these are second, third generation migrants. So at the end of the day, we're still providing them menial tasks. So it's not really child labor. So there are a lot of unfair, the parties on one side will say it's unfair measures. You're just trying to disguise these measures and say that, you know, we are not complying with trade and labor issues. The other party will still stand and say that you are using, you're polluting the environment through deforestation, loss of biodiversity. So it's quite a debatable issue. So there are a lot of issues here. Thank you so much.
Thank you. Any other speaker would like to add on to the unfair measures in your area? Prof. Dr. Jalila?
I don't have any comment on that. Yeah.
How about Prof. Dr. Bu?
I think we have to look at the whole social economic problem. To accuse a country to practice child labor, first we will see why these children are working in the field. Sometimes it's not the employer wants them. Sometimes the parents wants them. The parent, one or both parents want them to work in the field. So and the need the families need sometimes force the parents to want the children to work. So I think it's a very complex issue, and perhaps the international body, we should look at the international body's definition and then work with them to define it. And then meanwhile, each country should try to address the social economic problem rather than just have this a blanket accusation. It won't solve the problem.
Thank you.
View as a non-economist.
Rebecca, in your STEM cell area?
I think I would think there are some issues with the regulatory regulation of stem cell research. It's not really unfair, it's just that we need more regulation because currently there's no law to regulate stem cell therapy in the country. We have only guidelines. So I think there's a need for the country to come up with some policies or something to regulate the use of stem cell in the country. That's my view on this part of the stem cell research and therapy still needs some improvement. Yeah.
Okay, thank you. So question 5 is also from Tan Sri Dato Dr. Augustine Ong to Professor Dr. Rebecca Wong. So everybody want to live longer. So what's the role of MSc in anti-aging process?
I think there are many therapeutics effects of MSCs, and they have been used, like we have a lot of studies on research like skin, anti-aging effects on skin and so on. So there is a lot of potential there. And they have looked at different aspects of MSCs, like whether you can use the secretome, like what I've mentioned in my presentation. They secrete a lot of factors, and some companies are looking at the possible use of this. It may not be the injection of whole cells, but it can be used on the skin, like topical application. There's a huge, there's huge potential for MSCs in anti-aging. Particularly, I think everyone wants to look young and beautiful.
Yes,
so
yes.
there are a lot of research, of research on this area. And I believe it can, it has huge potential, not just in terms of the science, but in terms of the, business aspect. So I believe it has a great potential. And there are lots of studies which have been published in this area.
Interesting. We also want to be pretty. We want to be more intelligent and live longer. So you need to play a very important role.
But I guess that, as I mentioned previously, there needs to be some regulation on the use, and you can't just simply inject stem cells in anyone. So what I feel is that we need more control and regulation. Currently, there are only guidelines, but you need to have a law or something like that to regulate. So it can be used like ethically and used for the benefits of the patients or the person who wants to look more beautiful or younger. So this is my view.
Okay, so this is the last question for all the speakers. You have gone through a lot to this level. As a scientist, as a renowned professor, renowned inventors in your area, can you use maximum 3 sentences to encourage our young people to go into science, engineering, technology? Let's start with Professor Dr. Evelyn. We need more energy, synergy in science and technology. For young people.
Yeah, thank you, Prof, for the question. I think today we live in a world where research is very much interdisciplinary, or rather multidisciplinary. So if I start from the economic standpoint of view, yes, research has been very focused on markets and efficiency. So with that, I will say economics, 3 sentences, right? Economics is a dynamic discipline. It is no longer a standalone discipline. We use mathematics, we use statistics, we make numbers speak through our models. But today, is that sufficient? It is not. We need interdisciplinary and multidisciplinary. Interdisciplinary to look at other disciplines and integrate them. Sometimes we need a bit of law, legal, when we talk about legal frameworks. Sometimes we need to look at a specific problem from various angles. So multidisciplinary comes in. So one sentence, I would say, it's not a standalone, it's interdisciplinary, multidisciplinary, it's dynamic. Second, economic thinking is important in all fields. When you have data, numbers speak, you need policy implications. So economic reasoning or the way of thinking is linked to economics.
Yes.
So I think I'll stop at 2 sentences if I
Full of
may.
energy and Okay, let's welcome Professor Emeritus Dr. Bu. We need your synergy energy.
Well, for me, I think my advice for the young be curious and to solve problems. Don't complain. Use proper scientific methods to find the answers. And teamwork is very important. Thank you.
Yeah, don't complain, young people. Okay, let's welcome Professor Dr. Jalila.
Okay, I guess for the young, the most important for you, academic is important. And then since small, maybe at your level of higher education, you can, normally family, they are part of your contribution to know where your area, your career development. But I guess the most important, if you're interested in something, please read more about it, because now knowledge everywhere, you can read about it, whatever career that you want to be in, especially if you're interested in vet profession. Read about it, go, get exposure, especially related to the area, volunteering at the zoos, at anywhere that related to animals. That's what you inspire you and see how important for the career for your future. Thank you.
Very interesting. So be a volunteer and lifelong learning.
Mm.
Okay, let's welcome Professor Dr. Rebecca.
I think everyone has said what I have to say, but I do have something to say. I think you need to love what you do. So you need to have passion. And on top of that, you need to have very good role models. So I must congratulate Prof. Bu on your very outstanding achievement. To be honest, Prof, I have known Prof. Bu for many years, and she is my mentor and role model. I think when we have outstanding scientists like that, we have the passion, and we need more people like that in this country to motivate young girls and women to go for medicine, science, and research. So I think it's very important when you have someone to look up to. So I encourage all the young girls in this country to go after your passion, something that you like. And of course, it's a lot of hard work. If you look at Prof. Bu's achievements, it doesn't come in one day. It's a lot of hard work. So yeah, with that, I would like to congratulate Prof. Bu once again. Thank you very much for having me today.
Thank you. Thank you.
Thank you very much. Actually, I also quite impressed with Prof. Bu because she's very humble. When we pass the question to her, she's very humble.
Thank you.
Very
Thank
impressive.
you.
And then, okay, congratulations to all the winners. And you are all the winners here. You are the most outstanding ladies for 2023. Congratulations again. So we will break for 10 minutes. We will come back 10 minutes later. Thank you very much. Good morning. The Minds Young Woman Scientist Award Lady Minds goes to Dr. Lam Si Moon. She is an associate professor in the Faculty of Engineering and Green Technology, University Tunku Abdul Rahman. Her main research focuses on development of engineered nanomaterials for use in the wastewater purifications and renewable energy areas. Dr. Lam's R&D has also been expanded by research grants from myriad governments and non-government bodies including the Ministry of Higher Education, oil and gas industry, palm oil industry, as well as water and wastewater treatment industry, with the financial support of a total research grant of about 2 million. Her research work quality of international standards has been further supported by the publications of more than 80 World of Science in Text journal, 11 book chapters, and possess a H-index of 36. Moreover, Dr. Lam received the ASEAN Talented Young Scientist 2022, World Top 2% Scientist 2020 to 2022, ASEAN Women Entrepreneurs Leadership Award 2019, and Royal UNESCO for Women in Science Fellowship 2018. Let's welcome Dr. Lam Si Moon. Thank you very much.
Good morning, ladies and gentlemen. I am Dr. Lam from University Tunku Abdul Rahman. I would like to thank to Malaysian Invention and Design Society for giving me this great honor. I'm so honored to be here and grateful to be one of the co-recipients for this MINDS Young Women Scientist Award 2023. Winning this award would not have been possible without inspiration. I have received from my mentors, from my comrades, from whom I have derived the strength to challenge myself and perform better at each stage. I have faced several challenges on my way here, but each one of them have only strengthened me and made me a person I am today. A thorough professional who knows exactly what she wants and someone who set her eyes on a goal and does not simply give up. I sincerely thanks to each one of you, Professor Dato' IR Dr. Abdul Rahman bin Mohammed and Prof. Chen Hong Hu as my mentors, and Associate Professor CHMTS Dr. Sin Jing Zhong as my comrades, for helping me to reach a stage where I proudly receive this award as a mark of my achievement. Thank you. Good day to all. I am Dr. Lam from University Tunku Abdul Rahman. First of all, I would like to thank the MINDS for inviting me as a speaker for the presentation entitled Photocatalytic Fuel Cell as a Sustainable Wastewater Treatment Synchronized with Electricity Productions. Here is the agenda for the presentation today. We start with the introductions of the photocatalytic fuel cell, research gaps, wastewater treatment via the photocatalytic fuel cell, energy extraction from the wastewater, and conclusions. Wastewater as a new energy source. Our annual energy used in Malaysia for the water infrastructure is about 30 megawatts. It should be mentioned that the wastewater, such as the grey water or the industrial wastewater, contain 4 to 10 times amount of the energy in the wastewater that we can use for the wastewater treatment plant. So, if we could extract the small fraction of the energy in the wastewater, we could self-produce a green and an economical approach. The grey water is the focus of my research project. Grey water is a household wastewater that is derived from the kitchen tap, dishwasher, washing machine, bathroom tap, and shower. The grey water composition. It contains a high content of the laundry surfactant. It is a cleaning agent that we use during the laundry. some fraction of the nitrogen and phosphorus, higher in the salt content, and more alkaline pH medium. For a typical family of 4%, a weekly grey water production volume could be 1,120 litres from the washing machine and 1,680 litres from the bathroom tub. We assign energy for the water infrastructure. Water and energy are interdependent. They are known as the water-energy nexus concept. Water needs the energy from the pumping and treatment, and energy requires the water for the processing and cooling. A growing awareness of this concept has led to much research interest to reassign the energy for the water infrastructure over the years. My project deals with the development of the photocatalytic fuel cell using a pair of photoelectrode material in treating the wastewater and recovers the energy. Upon the light irradiation, the electron will be created and transferred into another electrode, generating electricity. The grey water is selected in this work since it is a household wastewater and has a great potential to be reused and recycled. This is a setup of the PFC fuel cell. It works in the fuel cell manner. When they are coupled in the series form, they can further treat the wastewater and generating more electricity. So, different from the traditional wastewater treatment where it's only decomposed in organic matter, my research goes beyond that. I'm studying a new method to not only eliminate the organic in the wastewater, but also recover the energy stored in them. Here is some research question of my project. Are the organics in the grey water able to be removed? Are the pathogenic microorganisms in the grey water able to be dissipated as well? Is the treated grey water safe to discharge into the water bodies? Is the treated grey water possible to apply in the agricultural crops? We need to surmount this research question before we start our project. So what is interesting in this project? The electricity that is produced in this work is able to power a 10,000 milliampere power bank by 6-hour PFC treatment, just for using the 400 volume of the grey water treatment. The treated grey water was also tested for the toxicity content. A reduction of the toxicity was observed on the treated grey water for some plant seed, for some plant, and the targeted fish model. In other words, the treated grey water was possible to apply in the irrigation purpose on the agriculture area. Many kinds of the photoelectrodes were also characterized to describe the effectiveness of the system. Here, I'm so glad to show you that the result of this work have published in the high-impact journal and received several national and international awards. The outcome of this work: the organics and the pathogenic microorganism is able to remove in this PFC cell. Simultaneously, we are able to recuperate the energy during the grey water treatment. The treated grey water is safe to discharge into the water bodies, And lastly, the treated rainwater can apply in the agriculture crops. As a conclusion, the PFC is not only to create the green and sustainable power energy, but it also introduced an economical and environmental friendly approach for the wastewater treatment. The PFC is able to reduce an operational spending due to the electricity production in the wastewater treatment plant. Moreover, it can reduce the impact on the climate change by reducing the fossil fuel utilizations. At last, I hope this research could spearhead Malaysia's movement towards the use of green technology to achieve the sustainable development and transform the science, technology, and innovation for our country in ensuring the long-term sustainability in the fields of energy and environment. Here, I would also like to share you my research experience and achievement. In year 2018, I was the recipient for L'Oreal UNESCO for Women in Science. Environment category. I also not forget to bring my student for some research, innovation, and invention competition. Here are some awards winning. Research attachment at China. I was given a plenty of opportunity to meet the various experts throughout the world. And currently, I'm also at China to receive another prestige award given by China government, which is the Asian Talented Young Scientist Award 2022. Research activities at overseas. I also joined the various research activities at overseas as an invited speaker, as a visiting professor, and also attending some conference. As a researcher, I also not forget to join the community service. I serve as a STEM academician for primary school, secondary school, international school, as well as an organizing event for the K2M event organized by Institute of Chemistry of Malaysia. There are also some community project collaborations among the Jambatan Kesihatan Batang Padang and JKKK Kampung Baru Coasting Bidor Perak. Here is my graduated postgraduate students. There are about 60% of the female researchers in my research group. As the young women scientist, I have the responsibility to ensure the gender equalities. In the class or in the meeting, I always tell my student, if I can do it, you also can do it. To continuously motivate the student to strive for an excellent result in their undertakings. Before I end my presentation, I would like to provide a quote here. Women and men have a role to play. Let's support more gender-balanced representation in the science and technology. We move together in catalyzing and transformation into the better world. Thank you.
The Young Woman Scientist Awards LadyMINDS goes to Dr. Nur Hafiza binti Abdul Khalid. She's currently served as a senior lecturer at the Faculty of Civil Engineering, University Technology Malaysia since 2016. She graduated from University Technology Malaysia with degrees in Bachelor, Master and PhD. She joined Hanyang University in South Korea as a temporarily visiting researcher in 2014 for international exposure. The same year, she also received the Young Woman Scientist Award from the Association of Korea Women Scientists and Engineers in South Korea. Her network and worldwide research connections have been considerably improved by these experiences. She is honored to have won numerous awards for her work in academic and research, including the Best Postgrad Student Award and the Chancellor's Award in 2016 at University Technology Malaysia. Let's welcome Dr. Hafiza binti Abdul Khalid.
Hi everyone, my name is Nur Hafiza binti Abdul Khalid. I'm from University Technology Malaysia. So today, I would like to thank to Yang Berbahagia Tan Sri Datuk Dr. Agustin Ong, President of MINDS, Yang Berbahagia Datuk Dr. Chun Yuen Mei, Chairman of the LadyMINDS chapter and the chairperson of the conference, to all panelists and judges for awarding me the MINDS Young Woman Scientist Award 2023. I know I was competing against a pool of talented researchers, so I never thought I could win. I believe my achievement and past academic research experience must have won the heart of the judges. Recently, I focused on CO2 capturing and storing technology in construction material. It produced very impactful findings. This research envisions to bring significant impact to combat climate change in long run via sustainable and intelligent production of CO2 capturing cement-based materials. This experience will become invaluable and added to top of my existing experience as young woman scientist. I really hope this opportunity enrich my journey to becoming a world-class researcher. I represent of my university, University Technology Malaysia, and me myself again would like to thank to all of you here. Thank you very much. Assalamualaikum and good afternoon. My name is Nur Hafiza binti Abdul Khalid. I am a senior lecturer from University Technology Malaysia, and I would like to share my topic today entitled CO2 capturing and storing CCS technology in construction material towards combating climate change. Before I start, I want to share my journey in this niche area in CO2 capturing and storing technology in construction material, and at the same time, it drives my career path. I have completed all my degrees in University Technology Malaysia with very limited international exposure during my study period. Understanding that such exposure is crucial in my career development, I joined the Hanyang University at South Korea as temporary inviting researcher in year 2014. And as an inviting researcher at Hunan University, China in year 2019 until 2020. These experiences have greatly enhanced my international research collaboration and network. In China, I learned a lot about CO2 capturing and storing technology in construction material with my professor Tun Chai Ling from the Hunan University. With the little experience in year 2020, I tried to apply Republic of Korea, ASEAN, with the topic CO2 capturing concrete. During that time, I won that award as next innovator and received about USD 12,000 from the Korea government. With the award money, I start to set up my first CO2 sequestration laboratory in Faculty of Civil Engineering UTM in year 2020. As you can see from the screen, I purchased my CO2 chamber and customized my CO2 granulation mixer. And recently, I have 2 PhD students work in this topic. Okay, now we're back to the topic. Nowadays, the people talk about 21st century concrete technology. The concrete technology for the sustainable development in the 21st century focus on the problem and the challenges for the concrete technology today and in the future with the particular emphasis on the environmental awareness. The researcher eager on the innovation through their research to develop their intelligent material, advanced material, green materials, which is to reduce the energy consumption and also towards the environmental awareness. And all of this is about in line to the national and global goals. Refer to the 10-10 MICE framework. Okay, they are highlighting about the environmental and biodiversity, and it's about to preserving and conserving the natural environment and biodiversity of Malaysia are important in enhancing in value of sustainable development. And also, we refer to SPB 2030. They also highlight about the green economy. If we talk about the new sustainable material, of course, they are related to the green economy. And also, it is this niche area in line to the Sustainable Development Goal SDG 13, which is a climate action. Okay, why they are talking about this? Because they are concerned about the global warming and climate change, which is this is a global initiative to lower the carbon dioxide level in the atmosphere. The most common greenhouse gases produced by the human industrial activity is carbon dioxide. Therefore, the carbon dioxide reduction may play essential roles in solving these problems. Without climate change mitigation strategies, worldwide greenhouse GHG emissions are expected to rise up to 90% by 2030. Okay, this is an example 21st century construction material. Nowadays, we are talking about self-compacting concrete, self-curing concrete, self-healing concrete, 3D printing concrete, green concrete, zero cement concrete, nano concrete, and now the latest is about CO2 capturing concrete. All this topic, all this example is about to take urgent action to combat climate change and focus on its impact, which in line to the SDG 13. When we refer to the Scopus searching engine, okay, we found that this CO2 capturing and storing technology in cement-based material led by the country from the China, US, and UK. And we found that the publication increased, which is to show this topic or this niche area is a trendy and become a demand research. Okay, back to the CCS technology. I'm going to talk about the very basic fundamental rule, how the CCS technology in cement-based material can be is a function as a CCS. Okay, first, all people know about the cement. Okay, cement when we add to the water, when we touch with the hand, we can feel a little heat. Okay, the heat is coming from the hydration product, which is calcium hydroxide. And when we touch it, it look like we feel sticky. This sticky is from CSH gel. Okay, this we call semi-reactivity. Okay, this calcium hydroxide, okay, when we react to the carbon dioxide, it produces stable carbonate and water. Okay, so the CO2 capturing can occur during this cement hydration. But when we add, we replace our cement with the amount of material that have high amount of calcium hydroxide. Okay, so let's say we are replacing with the lime. Okay, this lime, they have characteristic of calcium hydroxide. When we react to the carbon dioxide, we apply the CO2, it produces again stable carbonate and water. And again, at this stage, the CO2 capturing can occur during this lime reactivity. When we replace our cement with the pozzolanic material, nowadays we are talking about green material. They are adding pozzolan material such as fly ash, GGBS, and so on. So these pozzolanic material rich with the silica content. So when the gel react to the silica content, it produces more and more CS texture. So this gel become our concrete or our cement-based material become more dense, toward high strength and more durable. Then how to apply the CO2? By referring to the previous research, there are imperative practical solutions, which is they are directly inject the CO2 to the material, and then from the previous research also I found that they are applying the CO2 during the CO2 curing, or we call carbonation curing, and also they are pairing between the direct CO2 injection and also CO2 curing, and I can claim this is a double CO2 capturing in the cement-based material. Okay, refer to this publication research from the Tuchai link. This material, basic oxygen furnace slag, this is a waste material. This powder, they are applying the CO2, direct CO2 in aqueous solution, and then they threw the dry carbonation in the CO2 chamber, and then the material become carbonated material. And then this material was designed with the cement and aggregates, and also the mixing with the water to cement ratio of the water to cement ratio, and then they will become cement or mortar. Okay, they found that from this study they found that this material, this powder can capture this CO2 significantly. Okay, this is the applying the CO2 in dry condition also. This one in the aqueous condition, they are applying the CO2 in aqueous condition. This one they are applying the CO2 in dry condition, which is the powder. Okay, they are injecting the CO2 directly into the granulation mixer, and then they are making artificial aggregate, as you can see from this screen. Okay, now we are talking about CO2 curing. They are applying CO2 during the carbonation, CO2 carbonation. Previously, by conventional method, the cement, they are using the cement aggregates and water to become a concrete, and then through the concrete mix design, and then they are through the long conventional curing by using water and autoclave curing before they are produce the final product. Now, when we talk about the CO2 capturing, so we need to think that the cement can be replaced with the amount of waste material. Okay, they have very intelligent characteristic which is can absorb the CO2. So this is my current research. We use cement and waste material and become a mortar, and then through the mix design, and then through the CO2 curing. So this is a little fundamental that I can share to all of you. When the cement react to the water, it produces calcium hydroxide and the gel. Okay, this is coming from the cement reactivity. And when we add the amount of the lime waste, for example, the waste material for the lime-based material, okay, which is rich with the calcium hydroxide. So here, if you can see, the calcium hydroxide can be derived from the cement, and calcium hydroxide can derive from the calcium reactivity. Okay, this calcium hydroxide, okay, when we are making the concrete, and then we are through the curing, okay, so we are expose this concrete into the chamber, CO2 chamber, with some design of CO2 concentration, temperature, relative humidity, and time. So at this stage, the material can capture the CO2 because they have they have a CO2 calcium hydroxide. When the calcium hydroxide react to the CO2, it produces stable carbonate and water. And at the end, we found that the CO2 capturing concrete becomes dense and more durable concrete, and they have strength of the concrete. Okay, this is when we use semi-blended concrete. For example, we put the pozzolan material. The normal curing up to 56 days. So now if we export the CO2 curing, so up to 7 days, we can see it is very significant that the material have been carbonated. Okay, even up to 14 days is completely, most toward completely carbonated. So when we add more material or more waste material, they have the very unique characteristic, can absorb the CO2. So we can find that the highest content of the replacement to the cement can capture the CO2. Okay, up to 40 days. Okay, nowadays, recently, they are talking about carbonation curing using flue gas. So if you can see from this previous study, in year 2022 and the bottom also in year 2022, the study is about recycled concrete aggregate using flue gas. They are demolish the building, separating the elements and become recycled concrete aggregate. So they are treated this aggregate using flue gas. What is a flue gas? Okay, flue gas is the gas from any plantation. So they have waste gases with a high concentration of CO2 and another gases. So we found that this from the second study, okay, they found that by using this flue gas, the cement-based material they have a superior CO2 uptake mechanism. Okay, so I communicated few weeks ago with the cement plant. Okay, how to find the flue gas from their plant. Okay, they said they highlight the flue gas can be sampled or can be obtained from this dotted box, red box here. So it become possible. Also, we can conduct the similar research by using our local material to investigate the performance of CO2 capturing and storing technology in construction material. So this is a future application we can apply, which is carbonation curing. Okay, we can work on the carbonation curing. Normally, okay, for the concrete, they are applying water curing, autoclave curing. So nowadays, the researcher are looking on the carbonation curing, either via pure CO2 gas or flue gas. Okay, so from the previous that I mentioned before, we can get either if let's say we don't want to use the pure CO2 gas, we can they have high possible to use the flue gas become for our CO2 capturing and storing technology, because we understand that in the flue gas there high concentration of carbon dioxide, oxygen and nitrogen, which is we understand that nitrogen and oxygen is not harm to our global. So it is possible. Okay. If need to bear in your mind the flue gas in the different plantation will have different concentration of gas, different type of gas inside. Okay, and then in future, for the future application, we can focus on the precast brick blocks. Okay, this one is we call precast brick and blocks, and also we can make our artificial aggregates. Normally, when we want to make a concrete, we have cement, we have sand, we have a coarse aggregate and water. Now in Malaysia, they use granite as a aggregates, coarse aggregates to making a concrete. Now, in China, they are looking on the artificial aggregate, man-made aggregates, to replacing natural aggregate. And other than that, other than artificial aggregates, they are looking on the recycled concrete aggregates. That, let's say, they are demolish the building, they are separating the element, and then from the element, they are treated through the carbonation curing, and we call as a carbonated recycled concrete aggregate. And they found these carbonated recycled concrete aggregate, they have high strength and durable material, durable aggregate. We are talking about multiple helix impact. Impact to the environment, of course, through the CCS technology, we can directly reduce the emission. Okay, for the industry, let's say cement industry, for example, okay, they can reduce their CO2 emission, and then they can reduce the cost on separating and purifying the flue gas. If, let's say, we are applying our CCS technology via flue gas, for example, so they are not they can reduce their cost separating and purifying the flue gas. Okay, next is CO2 curing in CCS technology become an alternative to conventional curing. As I mentioned before, the conventional curing such as water curing, autoclave curing, and so on. This CO2 curing can become an alternative to the conventional curing. Of course, toward the CCS technology, we can reduce the cost of production of concrete. Of course, in line with the government initiative for adopting green technology for sustainability, and also in line with the government initiative to combat climate change, of course. Okay, and how about the impact to the society? We can increase the awareness for the CCS technology in advanced green material. We can reduce cost of the material while maintaining the concrete properties to improve people living expenses. To academia, this is interdisciplinary research involved. This niche area contribute new knowledge on the trendy CCS technology in civil engineering material and advanced concrete technology. Of course, to the government, increase the awareness for the CCS technology in advanced material. Next, reducing cost of the material while maintaining the concrete properties to improve people living expenses. This is the way forward that we can do together, okay, which is to combating CO2 via CO2 capturing concrete by utilizing alternative potential waste and CO2 waste, which is the flue gas. Nowadays, we can obtain the flue gas. For example, we can get from the cement plant, oil and gas plant, and so on. Okay, of course, we can popularize CO2 capturing and storing CCS technology in Malaysia. From my reading, from my reference, there is no research have been published on the on the CO2 capturing and storing, especially in cement-based material. And of course, for the future application, we can look onto the future brick, future block, future artificial aggregates, and so on. And I end my presentation. Thank you very much to audience, and see you again.
Our next speaker is Dr. Nik Mariam Nik Sulaiman. She obtained her Bachelor of Engineering Chemical and Master degree in Applied Science from the University of New South Wales, Australia. She went on to successfully pursue her PhD in Chemical Engineering from Birmingham University, UK. She joined University Malaya as an academic staff in 1983 and served as an active member of the academic community for more than 30 years. Her tenureship in University Malaya expanded beyond academic teaching and research. She was entrusted with several administrative portfolios, including as founder dean of the Sustainability Science Research Cluster until 2015 and as deputy dean of the engineering faculty. She was the holder of the prestigious Dr. Siti Hasma Muhammad Ali Professorial Chair in University Malaya from 2010 to 2014. She is also a board member of the Sustainable Development Solutions Network Malaysia. She is also a fellow of Academy Science Malaysia since 2019. She has made significant contributions as a subject matter expert across multiple government, ministry and agency, as well as providing consultancy in environmental management. Her current work includes a focus on mainstreaming sustainability in the process industry, especially analytics of GHG emission and ESG adoption by organizations. She continues to publish in peer-reviewed journals and gets involved to speak at conferences and webinars. Presently, she is attached as an honorary professor at University Malaya Sustainability Group. Thank you very much. Let's welcome Dr. Mariam Nik Sulaiman. Thank you.
Bismillahirrahmanirrahim. Assalamualaikum and salam sejahtera. Appreciation and thank you to the organizers for this opportunity to share some brief thoughts on a topic which are currently of great interest to many stakeholders, whether they are internal in your own organization, external to your organization. It can be in the corporate level, national level, and or global level. I have three big words that I'm using in the title. First, the word sustainability in its many different forms and format and understanding, and has been around for some time. Now, the term ESG is becoming another buzzword in the community, not only restricted to the business world, but gaining traction as it expands to the impacts of ESG agenda. I'm now also throwing in another big words, three of them, which defines innovation, being responsible and coming from the technological perspective. In short, I think I have a colossal work to try to share, but try to keep it simple by trying to connect the dots between these three words. Shall we go to the next slide to see further what I have to share? The many facets of sustainability. Let's position ourselves at the different disruptions and shifts that have occurred. And I have zeroed on the connection for the topic at hand, which is sustainability. Firstly, the concept sustainability, coming from the term being sustainable, sustainability, sustainable development, and you can map out what it means to you. You would probably end up with many ways of how different stakeholders see the meaning of this concept. What about the planet Earth as it is now? Is it in a state of flux? In that sense, I have picked out some keywords which I think are significant. The first one being Anthropocene, the currently accepted term by many scientists as an epoch where human activities play a key role in impacting the state of the Earth, be it biotic and abiotic ecosystem. Now, this state of affairs can lead to risks and opportunities, so much so that according to the World Economic Forum risk maps, for nearly a decade, it's been about climate change inaction, human-made environment degradation, and lately also, interestingly, it's about geopolitical insecurity and social issues. This begs another question. Are there safe limits that we as human beings should adhere such that the tipping point of irreversibility does not occur. Issues of interest span quite a number of big topics such as ocean acidification, biodiversity losses, biogeochemical cycles, which altogether can affect the health of the planet, or what is now termed as planetary health. In short, we can summarize the shifts as shown in this third section. We have gone from Holocene in terms of geological epoch to Anthropocene. Many things are integrated. We cannot see happenings or events as siloed. We have to attack or solve it in terms of an integrated manner, meaning that we are going from linear to circular. We are inundated with data. What was before few data has gone to become big data, from slow events to disruptive events that we see happening quite frequently nowadays, and from manual in terms of the way that we do our things to connection to IoT, augmented reality, and so on. Because this webinar is also about celebration of female scientists, I have sort of picked out at least 3 names which you may be already familiar, that has played a significant role in terms of sustainability. Rachel Louise Carson is a marine biologist, conservationist, and writer, well known for her writings on environmental pollution and the natural history of the sea. Her book, which sparked the silent movement called Silent Spring, published in 1962. Of course, we have Madam Gro Harlem Brundtland, the first head of the WCED, which altogether produced Our Common Future in 1987. And many of you may not know of this person, but she is Wangari Maathai, who was a Kenyan social, environmental, and political activist, and was the first African woman to win the Nobel Peace Prize in 2004. So, it's well and good to understand or appreciate the sustainability agenda, but the key issues, of course, how do we operationalize the sustainability agenda? So in this slide, I would like to point out some important key drivers that has made it possible for the sustainability agenda to be implemented. Let's look at the global scale. You have known or heard probably about the United Nations SDG, Sustainable Development Goals. Do you realize that we are already in the midterm in 2023 to implement SDG, which is actually a framework that should last until 2030. You may have also heard on a global scale of Paris Agreement about the ability of human beings, or the need for the human beings to try to keep temperature rise to about 1.5 degrees C. And there are also other organizations belonging to the United Nations, such as Global Compact, Principles for Responsible Investment, that are trying to operationalize the sustainability agenda. What about in our own country, Malaysia? We are also nearly in the midterm of the 12th Malaysia Plan. One of the game changers is also about sustainability. We also need to report on our own determined contribution to greenhouse gas emission. If you go towards the business sector, you probably heard about Bursa Malaysia sustainability requirements, and not forgetting the central bank, Bank Negara, on climate change and principle-based taxonomy. We go down further to the corporate level about driving the sustainability agenda, then you would probably see the total value generation, access to finance, risk management, and so on, for the corporate world to try to push the sustainability agenda forward. And all these, another question remains. How do we communicate our impact? This is where sustainability reporting comes into question. How do we communicate our impact? Well, it's about getting data, of course, and this is in the form of some form of disclosure. We need to document it so it becomes a report. We need to know who do we send the report to, the mandatory body, at the national level or even at the global level. And because there are many ways of reporting, are there standard framework or standards that you can use in order to report your sustainability agenda? We can get a little bit now in depth into the 3 words that we combine in terms of the sustainability agenda. So let's sit back and see what do we mean by the word ESG. For those of you who have not heard of it very much, ESG refers to the environmental, social, and governance factors considered by companies at the moment when managing their operation, and to their stakeholders when making investments in terms of the risks, impacts, and opportunities. So they are based on the 3 pillars of environment, social, and governance, where environment means opportunities to reduce adverse impacts on environment components and provide value to the stakeholders. By social, we mean managing and publicizing socially responsible commitment, and organization creates value and increase public trust by doing so. And governance is about accountability. I have to give credit to my fellow friend, Kati Shazrin, for putting this slide together, which is one way of looking at the relationship between SDG, CSR, and ESG, which leads to the sustainability agenda of an organization. As you can see here, ESG is mainly at the moment investment evaluation by investors as well as government. The community and the consumers and the society at large at the moment can have a large bearing on the ethical issues, such as socially and environmentally responsible events that the company has to think of. The business also has done some kind of community, corporate social responsibility, and the ultimate goals is based on the SDG can lead to a better way of looking or operating your sustainability agenda. Now we come to the 3rd word, which is responsible innovation. It has been around for some time. I was taken in by this innovation perspective because it is where we can put the elements of ESG and SDG, so it makes it more responsible. Going fast forward, the UKRI, or United Nations Responsible Innovation Guide in 2021 has come up with this definition of responsible innovation, which is a process that takes the wider impacts of research and innovation into account to ensure that unintended negative impacts are avoided, reduce barriers to dissemination, adoption, and diffusion of research and innovation, so that we can fully realize the positive societal and economic benefits of research and innovation. Some other ways that we can look at how responsible innovation principles are being founded are: it has an ethical acceptability element, it has a sustainability element, it also has a societal desirability, meaning that factors affecting the design, and when we bring about responsible innovation in the perspective of technology, it's about factors affecting the design and use of technology, such as cultural and geographical, social, political, legal and economic influences, environmental, economic and social sustainability. It should also include some consideration of social inclusion and diversity based on ethics, policy and governance. So I hope by the last 4 slides, we can see that the elements of responsible innovation should include ESG, should include ESR, and should include SDG element. Let's see a working example on the way that University of Malaya has come up with this blueprint or thoughts about inputting the ESG and sustainability agenda into the life of a higher institution of education. As we can see here, the pathway of sustainability agenda stretched over a few years. It has undergone a transformation of rather fragmented way of looking at sustainability agenda in terms of research, some curriculum, some outreach program, and so on. However, in 2022, has come up with a center called Sustainability and Development Center, which is now based under the portfolio of the Research and Innovation Deputy Vice Chancellor, with the following action plan. The vision is to transform into a model city campus in advancing sustainable, green and carbon neutral lifestyle and innovation. This is actually being acted out in terms of mission, in terms of stewardship, which is to champion sustainability agenda campus worldwide based on our own sustainability policy, which was enacted or ratified campus-wide in 2022. We also have an earlier version of Eco Campus Blueprint, and going forward, has also pledged to be carbon neutral by 2050. On the issue of research and innovation, we are supporting action-oriented research towards the sustainable, green and carbon neutral campus in order to uphold this stewardship. Whereas culturally, because we are actually dealing with young adults and also staff members, the idea is to enculture sustainable, green and carbon neutral lifestyle and innovation among not only the campus community, but our stakeholders beyond the campus. The function of this center is to have long-term sustainability governance and strategy. And as was told earlier in the sustainability reporting, we are monitoring, reporting, and another agenda would be about ranking. Research and innovation via Living Lab, action-oriented research. And going beyond the university campus would be outreach and capacity building to enhance the enculturation of sustainable practices. And in that sense, we hope we can achieve networking and collaboration with our partners, be they internal as well as external. So in UMSDC Central, which is the administrative center, we have 3 other entities, the Eco Campus itself. We have also another makerspace which takes care of the latest innovation, and Rimba Ilmu, which is really a jewel in of the greenery aspects of the whole campus. What have we achieved in trying to transform into a model city campus to advance sustainable, green and carbon neutral lifestyle and innovation? We have to walk our talk in terms of stewardship. We have done this way in terms of reporting that you can see in the various ranking. A large part of the whole UMSDC is also involved in terms of action-oriented research, and we have done it in the mode of living labs, which are action-oriented labs beyond the conventional labs that you see in the normal higher education or research institution. And to be encultured, we intend to inspire and be inspired as well by making people more aware and behave in trying to be more sustainable for the whole human environment. I think in terms of the present, of course, we need to have some financial incentive to make the events work. So at the present time, the grants have been made on some internal basis, and another way is to get internal grant, which we should be matching with external funding. For this year in 2022-2023 session, the internal living lab grant addresses circular economy. It also addresses carbon neutral, especially to uphold our target to be carbon neutral by 2050. And the Eco Campus is to grant address Eco Campus blueprint, which is based on 8 elements to make the campus more sustainable. Hopefully, we hope to find matching grant to address broader urban sustainability issues. And our main Living Lab program that has been successful in the past has been Zero Waste, which takes care of the solid waste element. Water Warriors looking at the water component, the Rimba project looking at the biodiversity and greenery. Eco-Friends more in terms of the behavior that we are addressing, particularly through the moss, and DUM is a medicinal aspect of sustainability where we're looking at what to do with medicines that have expired or are no longer needed by the patients. And I must say that the grants, these projects have been very successful in the past and is still now sustainably working towards their enculturation of low sustainability values, skills and lifestyles among the staff, student and connected communities. We must say that in terms of what's the outcome, one way that you can look at it is in terms of the overall performance of whether you like the word ranking or not. Last year, for 2023, we are 3rd in Asia, 1st in Malaysia, and 66th in the world. In Southeast Asia, we have been ranked as the most environmentally sustainable institution. Number 2, most socially sustainable institution. We cannot rest on this ranking. We have to move forward to achieve many other aspects that are really needed to make the whole eco-campus a reality. And I think I've come to the end of the sharing, and I would like to end with 3 sayings that I picked out that we can actually attribute to the 3 great female scientists. If we start with Rachel Carson, the human race is challenged more than ever before to demonstrate our mastery not over nature but by ourselves. You are quite familiar with the motherhood statement of sustainable development, which is development that meets the needs of the present without compromising the ability of future generations to meet their own needs. And of course, this and another word or quotation by Mathai: you cannot protect the environment unless you empower people. You inform them, you help them understand that these resources are their own, that they must protect them. And with all these quotations, thank you very much for listening to my presentation.
Our next speaker is Dr. Shahida Muhammad Sharif. She is the former head of technology research and CEO of Petronas Research Sdn Bhd. She has 35 years of experience in oil and gas industry with specialization in the area of separation processes and green and sustainable chemistry. Throughout her 35 years of work life, She has held various positions from Head of Process Technology, Account Manager of Petrochemical Group, and Head of Technology Management before retiring as CEO of Petronas Research. Her major achievements include Fellow of Industrial Engineering and Chemistry Division, awarded by American Chemical Society in 2018, a first for Malaysian to be awarded International Fellow by ACS. Leading figure behind the successful R&D projects in Petronas. Just to name a few, the loop-based oil processing pilot plant, mercury and CO2 removal using iconic liquid technology, and biomonoethylene glycol. She has been awarded 17 various scientific awards and written several journal articles. She holds bachelor degree in applied science, applied chemistry from Queensland Institute of Technology, Australia, PhD from University of Leeds, UK, and Doctor of Science distinction from Queen's University of Belfast, UK. She is currently a Fellow of Chemical Sciences in Academic Science Malaysia since 2021 and is part of the task force building industry-ready talents. Let's welcome Dr. Shahida. Thank you very much.
Assalamualaikum and good afternoon, ladies and gentlemen. Thank you so much for staying put to listen to my presentation. I know it's challenging when my sharing comes in between your lunch, and especially today is your weekend. But allow me first to thank the organizing committee, led by Mr. President, Academician Tan Sri Emeritus Professor Dr. Augustine Ong, and also Yang Berbahagia Dr. Chu Mei Yuan, for inviting me to share my past experiences in science and technology world for the past 35 years. I sincerely hope that you will be inspired to pursue your career in science, technology, or even social science by end of today's conference. My presentation today is entitled Not Seeking an Equilibrium, Going Against Entropy. Don't be misled by this title, as I will not be talking to you about thermodynamic or entropy law, as I know it's the least favorite subject or topic. It's just a title that I want to talk about, focusing on chemistry and how it affects our life. If we study chemistry because we want to change something to a better value matter, you know, long time ago, alchemists even tried to transmute lead to become gold. So we too wants to change for better life. So we bend the equilibrium and entropy law to create a thinking that life will be so much better in future. So you can see here, this photo in the slide was taken from Prestige magazine, March 2020. It's a supplement in conjunction with International Women's Day 2020. And I'm sure some of you may recognize, if not all, but majority of the leading Malaysian women across the field of science and technology. And I feel deeply honored to be featured alongside this amazing woman. So let me start by introducing myself. I was born 58 years ago in a small village in Batu Pahat, Johor. I'm the 11th of my big family, and I'm the youngest too. So we hail from a very humble beginning, but my parents emphasized the importance of education. So my interest in science and technology only developed at a later stage in life when I decided to enroll in degree of applied science in applied chemistry in a university in Queensland, Australia. The intent was just to accumulate credit to transfer to another course. But that's when an unexpected love started to bloom in chemistry, at least for most of the branches of chemistry, well, minus organic chemistry. is my least favorite subject, but I always blame it on the professor. After 3 years, Alhamdulillah, I came back to Malaysia and then served Petronas as a junior chemist. As a junior chemist, my first task was to conduct crude oil analysis and develop its characterization. So it was really an interesting area, and I managed to apply whatever I learned during degree. Then after 5 years serving the company, I received another opportunity to pursue my master's in research in chemistry. This time, I decided to go to University of Leeds in UK because they were the leading university in studying supercritical state of matters. Upon successful completion of this MSc by research, I was given the opportunity to pursue the same research to PhD level. And I was fortunate that my sponsor actually strongly supported the idea. So I returned home 3 years later with PhD in chemistry, specializing in separation of hydrocarbon metals using supercritical technique. But to cut my story short, upon returning back to the company, I was given the opportunity to hold various positions, from being a senior researcher to leading a department, a process technology department, then as account manager to manage business dealing with various businesses. And then I also had the opportunity to head technology management team, mainly for downstream projects and technology. This is where you bring technology from research to commercialization. And finally, 6 years ago, I was appointed as the First Lady CEO of Petronas Research in Berhad. So life was never dull and is always full of challenges. And as a result of challenges will always be success stories. But after 35 years in oil and gas industry, that's when I decided to focus on another aspect of life, thanks to the pandemic. So that hence the decision for early retirement in October 2020. By the way, I am married to a sportive husband for 35 years and blessed with 4 children and one grandchild. And my children are all working at various fields, and just to note, none of them are chemists. So this is an achievement slide. This is where we are thinking when we achieve something, has equilibrium been achieved? So for the past 10 years of my working career, before I decided to call it quit, my main role was to mature technology from R&D, deploy it through testing at various fields and scenarios, and then passed it to the marketing team to commercialize them. On this slide, I'm sharing with you the success stories in technology management as a result of managing about 500 researchers and various industrial partners, including research institutions, universities, locally and globally. This includes awards and recognition, increased number of publications and intellectual properties, technology product being commercialized, hence economic return realized, and also products that goes to commercialization in very short period. So one success story was when we developed this mercury removal system. The product was developed as an effort of collaboration partners between our researchers. In 5 years' time, we have successfully piloted at one of the facilities in gas processing plant. We've actually saved the plant millions of ringgit, and this product has also won various international awards too. I am also honored to receive fellowship award from American Chemical Society, which is the first of any Malaysian. And I am extremely proud of the achievement from my team. It's as a result of hard work, dedication, and sheer determination. Winning awards are just affirmation and validation of their excellence. But how do we get there? So change needs to happen. So how do we keep our non-depreciated asset to survive any time? Asset here means our manpower, the continuous research project and facilities. It was certainly not a smooth ride, because upon receiving the appointment as the CEO of the company to lead the 37-acre space, which housed the research center in Bani, and that was 7 years ago, okay? First thing we did was we reviewed the strategy of R&D and conducted situational analysis. We reviewed the research project being conducted and discovered that majority of it were on short-term basis, i.e. less than 15 months secured funding. So every time when we want to extend any project beyond that, we need to develop a lot of work, come up with proposal and represent it to the businesses or even higher management. Next, we assess the 370 manpower strength. Do they have the capabilities and agility to be globally renowned researchers or scientists? So the ratio of PhD to non-PhD in the facilities then was 1 to 28. Well, we can't blame them because most of them are bachelor degree holders. Upon graduation, they were hired and put into the same. So then we assess their awareness in IP management and also whether they understand how to generate IPs. And also whether they have presented papers at international conferences. So for the manpower strength, we want to improve their capabilities with research mindset to ratio of 1-to-1, PhD to non-PhD in probably 10 years' time. And we want to increase IP generation and be sure that our presence felt globally. Then our next challenge is also the facilities. Mainly, they are aging and outdated facilities. So we need to determine what would be the fit for purpose facilities. As we cannot be investing in every single equipment, we reviewed the facilities for our collaboration partners and included in the agreement of using them as and when needed. So the new target would be, i.e. the endpoint, our research facilities and manpower strength, not by expanding the current acreage, but by expanding it through partnering with collaboration partners locally and globally. And that's why we have our research center being housed in local universities, which being housed in some of the international universities. So that's what we did. And then in this way, we have a lot of manpowers, up to 500 personnel. And next, the target was to make sure these personnel are being groomed to do PhD upon doing their research. So how to drive this change is, this is all about going against the atrophy. The key element and strategy comes from strategic effort that has been developed, be it by the company or also the country. So for example, we have the moving forward together 50, 30 and 0. You can actually look into the detail of this moving forward strategy. We also look into the national energy policy and 5 years business development outlook. From these policies, we develop our own technology agenda. And this agenda, we want to make sure in line with business requirement. So in a way that whatever we do, we don't short the result of our technology will then easily be accepted by the user, and because this is what they want. Then we look into capability development. For this, we developed this, what we call a scientist development program. This was endorsed by the management. Part of the intent is to create a well-rounded, world-renowned scientist with quality, competency, and they must have professionalism and integrity. We want our researchers to think outside the box and be inventive. This program has a target of getting 1-to-1 ratio of PhD and non-PhD in 10 years' time. And we want to increase the number of IPs filed, which you have seen on the success story slides just now, and of course the business value. So what we did was we conducted first the staff competency assessment, where the results showed that who are keen to continue their career as researchers and who are not. You don't penalize them, but we allow them to be transferred to other units or businesses. Next, we started collaboration in research strategic areas with research institutions, universities, locally and globally. And part of this agreement was for the universities to provide avenue for the researchers to conduct research and enroll themselves as MSc or PhD student. So as a result, after 5 years of this program, we have successfully built good manpower strength in R&D, and the ratio of PhD to non-PhD has been reduced to 1:5. And I am confident that in 10 years' time, they will achieve the target of 1:1. But a reminder that every project requires team effort in every aspect of the whole value chain, from whether they are researchers, chemists, engineers, or even the marketing and finance person. It is important that everyone understand each other's requirement, and the critical leadership started early at the beginning, where the starting point is R&D, and it's managing the researchers. So researchers have to lead the technology development in steering the operation and product specification in order to gain momentum, and also later the benefit and respond to market demands or any new challenges. So what we did was we make sure team from engineering and marketing were involved even at the early stage of research. Even if they don't understand the science behind it, it doesn't matter, at least they understand why we need to conduct the research. The next challenge is to speed up the research. Normally, you have to wait for 15 to 20 years before you see one technology product to get to the market. So we want to improve that. As I mentioned just now, we have one product that gets to the market even after 5 years. So it is possible. So changing the mindset of end user is also a big challenge. Users tend to opt for a well-known product supplier. New product, I do not want to test it first, so you can go to another person to test it. Once successful, only you come to me, that sort of thing. So users tend to opt for something that they are comfortable with. So we need to develop enough database to prove the result of our technology. So if we think about the amount of funding required to conduct R&D is big, then the amount is bigger when we want to test the technology in the field or even to commercialize it. So a lot of convincing is required because the business has to fund this testing. So at any stages of conducting R&D to commercialization, if you fail, make sure we celebrated this failure, as every lesson learned that we get, it become a part of the database and it will become our best lesson learned. Failures is always our best lesson learned and how we're going to move forward. So I'm just highlighting some of the challenges and how we overcame this barrier before you can actually achieve these success stories. So remember everyone, success is not just for you. Any success, small or big, need to be shared with others. So any achievement in life will not be on solo pursuit, but as a result of team effort. Team means that not just your fellow researcher, but it could be your family, colleagues, and friends. So they are all directly or indirectly contributed towards the success. As in chemistry world, the main challenge is not in seeking equilibrium, but continue to go against the entropy. Well, a message to all the women out there, I personally think that there's any barrier that can stop us from achieving our dreams. So look at the things positively and push towards overcoming these barriers in front of you. Do not ever give up. Stop creating reasons for any failures that you face, and instead learn from the mistake and move forward. I hope everyone here will continue to push towards excellence in science and technology. Let us be known through the eyes of the world of our great achievements and leave behind to future generations a legacy that makes them proud of their ancestors. With that, I thank you everyone for listening.
Thank you very much. Our next speaker is Professor Dr. Lee Ping Chin. She is the current director of the Biotechnology Research Institute at University Malaysia Sabah, UMS. She holds a doctorate in biotechnology from the University of Tokyo, Japan. She is engaged in active life science research, particularly in microbiology and molecular biology. She has developed assays for kinase inhibitors screening, such as anti-malaria therapeutics, and a multiplex PCR approach for fast and accurate malaria detection. Her research into diseases such as hemophilia and thalassemia, which are of high prevalence in Sabah, enable the establishment of mutational genetic knowledge that's used for diagnostic and clinical management for better healthcare to communities in Sabah. Using molecular and genetic approaches, she has translated her findings into developing novel assays to detect diseases and identify potential therapeutics. Her research outcomes have been documented in more than 100 articles in scientific journals. Professor Lee's research network has been expanding from within the country and other parts of Asia and Europe. Professor Lee has received numerous awards and honors for her scientific contributions nationally and internationally. Because of her significant contributions to science, her viewpoint is frequently sought. She is a member of several committees, including the Technical Committee of Science and Technology Development for Sabah. She emphasizes the use of science to improve the social economy of Sabah. During the early COVID-19 pandemic, Professor Lee has aided the Sabah government in quickly establishing laboratories, trainings, and capacity buildings for COVID-19 testing and performing the tests for the state. She is now leading the genetic civilian for COVID-19 for Sabah and the Federal Territory of Labuan. Let's welcome Professor Lee. Thank you very much.
A very good afternoon to Emeritus Professor Tan Sri Dr. Augustine Ong, the President of MINDS, Dr. Chu Yuan Mei, the Chairperson of LadyMINDS Chapter, to our session chair, Professor Dr. Liang Wan Li, and to all the participants. First of all, thank you very much to Tan Sri and the organizing committee for inviting me to share my research experiences here in this event. Today, I will talk about translational biotechnology. The field of biotechnology is very broad, involving many areas. Today, my talk will focus on navigating paths to malaria diagnosis. Before we talk about malaria diagnosis, let me give you some background on how I have started my research on malaria. Before we start, let's look a little bit, let's listen to a little bit of background of cells. All cells communicate, and cell signaling is the ability of cells to receive, to process, and transmit signals with its environment and within itself. In fact, cell signaling is a fundamental process of all cells. In the prokaryotic cells, the signaling is comprised of two component systems, which consist of sensor, that is a histidine kinase, for receiving external signals, and a regulator. Meanwhile, in eukaryotic cells, or in higher organisms, The signaling is more complex, as you can see here, and it is comprised of serine, threonine, and tyrosine kinases. In my early career, we have identified another type of signaling in prokaryotic cell, which is similar to the eukaryotic cell, that are comprised of serine and threonine kinases. These serine threonine kinases play important roles in prokaryotic cellular functions such as growth and differentiation. When the external environment change, prokaryotes rely on this signaling transaction system. So what does it mean? It means that microorganisms can intercept the whole signaling system for successful colonization. And in other words, they can mimic the signaling system of the host cell. So this signaling system is found in all living organisms, including the parasite Plasmodium that is causing malaria. In the context of Plasmodium parasites, the kinase are involved in many cell activities. It is regulating vast cellular processes of the parasites, including regulating the cell cycle, cell development, gametogenesis, and the progression of the disease of the parasite in the host cell. So if you can find an inhibitor that inhibits the kinases, you can inhibit the growth of the parasite. One aspect of my study is screening of the rich biodiversity of Sabah for potential inhibitors against these kinases, and especially the kinases of the Plasmodium parasite. We search for potential inhibitors from the forest, the plants, the soil, and also our marine environment. Today, I will not talk on that topic, but focus into the diagnosis of the malaria Plasmodium. So as you know, human malaria is caused by 4 species of Plasmodium. That is Plasmodium falciparum, Plasmodium malariae, Plasmodium vivax, and Plasmodium ovale. In Malaysia, zoonotic malaria was first reported in 2002 in Kapit, Sarawak. It is caused by Plasmodium knowlesi, and the vector was mosquito identified as Anopheles thalians. So what does it mean by zoonotic malaria? Well, Plasmodium knowlesi naturally infects macaques. It's malaria in monkey. However, it also infects humans, causing malaria that is transmitted from animals to humans. So naturally acquired human infections of P. knowlesi were thought to be extremely rare. However, human infection have since been described throughout Southeast Asia. And P. knowlesi is now recognized as the 5th species of Plasmodium causing malaria in humans. It has high mortality rate. Well, it is zoonotic malaria because the Plasmodium knowlesi's host, natural hosts, are the long-tail and pigtail macaques. These macaques are commonly found in Borneo. And human knowlesi malaria cases are of public health concern in Malaysia due to the high incidence, mainly in Sabah and Sarawak. The Plasmodium knowlesi infections cause a spectrum of disease and are potentially fatal in humans. But if detected early enough, infections in humans are readily treatable. Hence, the ability to diagnose is crucial. So in malaria diagnosis, Microscopy is the gold standard for the diagnosis of malaria infection. Well, during the diagnosis, basically, the thick and thin blood smear are prepared, and the slide is stained and observed under the microscope. Another method that is used is the rapid diagnostic kit or the rapid diagnostic test for malaria diagnosis. This test is fast and easy to use, just like the rapid test kit that we use for the COVID-19. Yeah? So, however, there is a drawback on the RDT test. The kit was developed based on the 4 species of human malaria. Hence, it is unable to detect zoonotic malaria. So there are many false negatives when we apply this kit because most of the malaria cases in Borneo especially were caused by Plasmodium noisei. Meanwhile, for malaria microscopy, when we are using the microscopy approach, this is how it looks like under the microscope. Well, for an untrained eyes, for the untrained eyes, it all looks like the same, isn't it? It is difficult to identify the Plasmodium species under the microscope. It actually needs trained and experienced personnel to correctly identify the Plasmodium species. It is necessary and important to correctly identify the Plasmodium species so that appropriate treatment can be given to the patient. So it is challenging to use this approach. So that is why we have looked into other options. We look for other approaches for diagnostic of malaria. One of the very powerful tools in biotechnology is the polymerase chain reaction, or in short, PCR. PCR can rapidly amplify a specific region of a gene or specific segment of DNA to millions or billions of copies. So this allows the identification of the Plasmodium species accurately and correctly in a relatively short time. So using this PCR technology, we have developed a kit that allows the rapid identification of the Plasmodium species. It is able to simultaneously identify and differentiate the 5 species of Plasmodium and quickly diagnose the disease. So this is a very important step, important development in malaria diagnosis. So this technology was transferred to public health laboratory in Kota Kinabalu, Sabah. So I have trained, I think during the early 2010, I have trained personnel and technicians to correctly identify malaria using this technology. So we have also standardized the PCR technology in diagnosing the Plasmodium species in the public health lab. When we applied this technology to the previous samples, we found many misdiagnosed cases in which about 13 and 10% of the P. noisei infections were misdiagnosed as P. falciparum and Plasmodium vivax, respectively. Using this technology allows us to correctly identify the Plasmodium species that is causing malaria in Sabah. So when you look at the statistic here, it shows that in cases diagnosed with P. vivax in green and P. falciparum, the blue line here, are decreasing. and the red line showing P. norsai cases are increasing. The pie chart here indicated that most malaria cases in Malaysia were caused by P. norsai. In fact, more than 90% of malaria cases in Sabah today are caused by Plasmodium norsai. So now that we are able to identify the culprit causing malaria in Sabah, this allows us to better manage the control of the vector that is causing the disease. So if you look at the distribution of cases in Sabah, you will see that most of the cases are concentrated around the agricultural zone and those in close proximity to the forest. There was only low incidence in urban areas. So this allows us to assist the public health and the health department in controlling the vector more efficiently. And with the ability to diagnose and to identify the species that is causing malaria more accurately, you can look at the statistic here that the number of incidents and cases of norsai was getting higher. In a graph below, and in the red bar showing the human malaria cases is actually reducing and also almost eliminated. The incidence of malaria cases caused by P. norsai is increasing. So what is more significant that I want to highlight here is, despite the increase of zoonotic malaria cases, the mortality rate is reduced. This is because of our ability to correctly identify the species that is causing malaria and reduce the cases of misdiagnosis. And therefore, appropriate treatment can be given, and hence the mortality rate is decreased. We also look into the potential of using this technology to diagnose other diseases. My group has also developed a rapid diagnosis tool for detecting melioidosis and can be deployed in the field. So it is still using the powerful tools of biotechnology, using the PCR technology. Other than that, the same technology was also applied during the early phase of the COVID-19 pandemic to detect COVID-19. During the early outbreak of COVID-19, despite not knowing how the virus is transmitted, we brave ourselves to perform the screening and tests, assisting the state government and the country in managing the disease. I have also quickly established laboratories, providing training and capacity building for COVID-19 testing. So I'm also currently leading a team in the genetic surveillance of COVID-19 for Sabah and also for the Federal Territory of Labuan. So these are some of the photos that I'm sharing, showing some of the activities. Besides that, I'm also actively engaged in rural communities in Sabah. Engaged with the rural communities in Sabah. We help the community in Sabah, especially the rural communities, in screening and diagnosing diseases such as thalassemia, hemophilia, blindness, and which these diseases are of very high prevalence in Sabah. So we are just playing a small part of providing better healthcare to the rural communities. Sometimes the focus should not be solely on products or the money, but our services to our communities, finding innovative ways to overcome challenges and making contributions to our society. With that, thank you very much for your attention.
Thank you very much. Very impressive, Prof. Lee. We received quite a lot of questions from the audience and delegates. For question 1 is from Ms. Yong Yen Lee to Dr. Lam. How much time or how long will be taken to achieve the reduction of COT 98%, and what is the starting COT and OG of the influence water? What are the main differences with regular anaerobic process for effluent treatment?
Thanks, Prof. Leong. So thanks, Ms. Yong, for your question. Yeah. Well, actually, for the COD to reach about 98%, it start with an initial COD about 350 milligram per liter. For ONG, we did not monitor them as they are very negligible in our greywater. So the difference between the regular and anaerobic process with my photocatalytic fuel cell is considered as an tertiary treatment. So the tertiary treatment can actually further bring down the COD or the BOD to lower concentrations. For example, one of the recent industry project I'm currently dealing with, which is the palm oil mill effluents, where using this tertiary treatment, I'm able to bring down the BOD 3 to below 20 milligram per liter, which is the industry needs nowadays for Sabah, Johor requirement, because they have a slightly lower BOD 3 requirement. So I hope this research can further benefits for our industry and also throughout our Malaysia and the nation as well. Yeah, that's for my answer.
Thank you very much. Impressive. Question 2 is from Tan Sri Dato Dr. Augustine Ong to Dr. Lam again. So is your system applicable to palm oil mill effluents?
Yeah, thanks, Prof. Leong. So as I mentioned just now, my system is able to treat this palm oil mill effluents. Well, actually, the more organics it is in the industrial wastewater, it can generate more electricity generations. So for palm oil mill effluents, I have just a deal with the industry before I went to China this week. Well, actually, we have a setup at the industry site for this palm oil mill effluents at Perak, iconic the Tian Xiang palm oil mill industry. So I hope this project will still manage to further beneficial to our industry players and ever successful for these projects. Yeah, thanks, Tan Sri, for your question.
Yeah. Question 3 is to Dr. Nur Hafiza. So any examples of applications to coal-fired power plant and flue gas from palm oil mill?
Okay, thank you very much for the question. So far, when I read through the literature review, there is no application from the coal-fired power plant and from the palm oil mill. But as long as the plant can produce the flue gas, so that I believe the coal-fired power plant from the palm oil mill can be applied for future CO2 capturing technology.
Interesting. Question 4 is from Michelle to Professor Dr. Nick Merriam. In your point of views, how long our Mother Earth will be last?
I am. Thank you. What an interesting question. I wish I have an answer. You have heard the doomsayers say before, Earth should have gone out, long time ago. You can also answer it on a science-based basis. So far, I haven't heard of any scientist based on scientific facts and so on that says Earth will be out of the system by year something. And so I have no answer on a scientific basis. There hasn't been any, actually, no scientist has come up with any algorithm or science-based. What they are doing now is look at the planetary safe limits that we should be thinking about so that we don't have the irreversibility tipping point that we cannot go backward. On the other hand, if you look at the faith-based depending which faith base you're coming from the Islamic point of view, it will end someday. But nevertheless, we should always be hopeful. We should do our bit to keep the earth as sustainable as possible. So that is my short answer. Let's leave to the end of the whole day to God.
Yes, very impressive and interesting. Okay, we have this question 5 from Ms. Nur Aim to Dr. Shahida. Scientists, researcher, professor keep on producing a lot of publications. Do you think that aiming for a high number of publications is a good approach for researchers? Dr. Shahida.
Thank you, Ms. Noran, for the question. It's producing publication is one of the way to ensure that your researcher learn to share what they have done and improve their technical writing. I think a lot of our researchers are lacking in telling the masses what they have done, and some has good findings and yet they're not able to put it in writing. So publication is one way to encourage them to write. And next to publication is about asking them to present it at conferences so that they learn to speak to the public, to speak to the masses on what they have done. So we do not want silo researchers or scientists. We want them to be able to tell the whole world what they have done. You know, whether it's good or bad, because the bad part can become their lesson learned. That's my short answer.
I would like to open this to other researchers. Can we have Dr. Lam?
Yeah, I agree with Dr. Shahida. Yeah, in the class, I always tell the student, a good engineer, a good scientist should know how to present their data presentation instead of working in the lab or in the industry. So that's why I'm having all this kind of assignment for them to present their work in the class, not just a written report. I always emphasize this element in my lecture. So I agree with what Dr. Shahida said. So in the future, we should produce the graduates, which is beneficial in all kind of the cognitive, the psychomotor, and the aesthetic element, which is needed by our Malaysia educations. Thank you.
Interesting. Okay, Prof. Lee, your views.
Hi, good morning. Good afternoon. Yeah, definitely. I totally agree with both of the speakers just now, because I think publication is important for us to convey what we have found to the public and also to the community. So and through publication, actually, it is what we call as not syok sendiri lah, kan? So through publication, we inform others what we have found. And actually, the process of publication is not easy, actually. So it's go through a lot of reviewing and comment from your own peers and our reviewers. So meaning that whatever that is published is validated. Yeah.
Okay, Prof. Nick Mariam, if scientists, researcher, postdoc keep on emphasizing, I want to have more and more publication, I want to have more number, is it a good culture?
Okay, let's look at it this way. To me, you need to publish what you're doing so that people know what has gone on scientifically. But it has to go beyond that, because that is part, for me, publication is more like an output. You really have to think about the outcome, and expanding the envelope further is about the impact that you're doing. We would like to get a return of value for the amount of time and money that the research has come in. So that's why I think in the research landscape nowadays, for funders, they're not really looking at publications per se, but they're looking at the impact of your research and the return of value to the whole of especially to the community. So we have a responsibility to do beyond publication. I'm sorry, it's another KPI, but that's the way it is. Thank you.
Yes. Okay, question 6 is from Mr. Muhammad Hashim to Prof. Lee. So what are the challenges in reducing malaria cases in Sabah, especially among native ethnic groups?
Yeah, thank you for the question. Yeah, it's very challenging, to reduce the malaria cases, especially zoonotic malaria. So in the context of Sabah, I think one of the challenge is because of the infrastructure. So Sabah has many forests, So one of the challenge is because of the infrastructure, and especially in villages. And in terms of ethnic groups, not really because of the different ethnic group, but it's because of the accessibility, to medical, clinic, So in remote area, especially, if they are sick, normally they will not go to the clinic to seek for help or seek for help. So normally they will try to see what's the event after that. So if they recover, then it's okay. But if it's not, and they will only seek attention of medical attention when they are very, very sick. So that is another challenge. And of course, malaria itself, the plasmodium itself, is very adaptable. Okay, so it's highly adaptable to the nature of the vectors, and also to the parasite itself. And another aspect of it is the development of resistance to pesticide, insecticide actually. So, but in Sabah, we have not seen any resistance yet towards the parasite molecule. Yeah, but I think the overall challenge is, I think we need very good coordination, from all the parties that are involved to really eradicate this disease. Yeah.
Very impressive research. So this is my final question to all before the closing remarks. Now you are given a chance to have one dream, one wish. So tell me your wish and your dream. Start with Lam.
Thanks, Prof. Leong. If I have one dream will be given to me, I will continue to represent as young woman scientist to do the best thing that I can contribute to the green technology, which is the aim that I wish to have my technology to be commercialized as first, and then to motivate more young girls to follow me as a path for me to pursue as a young and then turning to the aging woman scientist in the future. That is definitely. So that's an aim for me at the moment. Yeah.
Is it your
Thanks,
girl
Prof.
or next to you? I saw a hand with camera.
Yeah, that's my husband is helping to get some photo for this.
Very sweet, very sweet. Okay, can I invite Prof. Nick Mariam? What is your dream or your wish?
Well, Prof. Leong, you're asking me as a baby boomer, and I think there are not many baby boomers around in this conference. Maybe Tan Sri Ko. Anyway, having passed through the journey, I think people should enjoy their journey on Earth. You know, the question was relating when Earth will end. Whatever time you have on Earth is enjoyed to the best of your ability. Have your potential to the best that you can. I'm really a knowledge-based person. It never tires me to seek knowledge in whatever form. And I hope in the time that we have, I can mentor as many people as possible. And mentoring is a two-way process for me. I learn from them, you learn from me together. Thank you.
Yes, you learn from me, I learn from you. Okay, let's welcome Dr. Shahida.
Well, I think I have achieved most of my dream, especially in my career. That's why I decided to quit. And I want to enjoy the other half of my life. Like Prof. Nick said, time to enjoy, time to venture and look at the rest of the world. I've been going to most places in the world, but more because of work, but I did not have the chance to really enjoy and look at the really the beauty of Earth. So this is the time I want to spend and move forward in exploring or travel and look at the various ethnic group and the wonders of the world. But the other one is I hope that women out there, especially those working mothers, will be patient in the challenges that thrown to them and not just simply quit, because there's so much that you need to persevere, and I hope they will move forward, because after all the effort you made to study and become great in your own career, so let's not just quit just because no one wants to look after your children or your small kids. So there must be ways. So all the best to them, and I hope they will continue to persevere and bring Malaysia to probably one of the women in Malaysia be successful and be known to the rest of the world. So that would be my greatest dream of achievement.
Yeah, it will come true, definitely. So let's hear from Prof. Lee.
Okay, thank you. Wow, I would say I have a very blessed life. I think I'm living my dream now. But anyway, yeah, I mean, we work hard, we achieve what we want to achieve. And we have to know where is the limit. There are things that we can do, and there is things that we might not be able to do. So yeah, we take it as it is, as long as we have tried our very best and be confident in ourselves. But in terms of not really my dream, but my hope actually is to, well, I'm engaged in a lot of community work, especially with the remote area, the rural communities in the remote area in Sabah. So I really hope that my involvement, although it's very, very small, playing a very, very small role, hopefully one day it will bring changes to that communities, and also they will be able to progress together with all of us. Yeah, that's my hope. Yeah, thank you.
I feel very touching, actually. Okay, good to be young. So let's listen to our young friends here, Dr. Nur Hafiza.
Okay, thank you very much. Actually, I want to relate to my niche area. I highlight just now. Actually, I have very big dreams. I want to be a woman high-class researcher, and also I want to develop my own laboratory, especially on the CO2 capturing laboratory, especially for the construction material application. And this is as a ASEAN hub as a reference. And now I'm struggling actually from the industry to this niche area.
Your dream will come true one day. I also went to Korea, the young scientist camp. Okay, good to be young. So thank you very much. Now we proceed to closing remark. Thank you. See you. Ladies and gentlemen, it is indeed my pleasure to give the closing remarks and express gratitude to all those who make this event a reality. The aim of this conference was to recognize eminent women and inspire and empower the younger generation of women. I sincerely thank our panel of esteemed women scientists who came here to share their ideas and energy and gave us a glimpse of their profound accomplishments. Professor Emeritus Wu, the recipient of the MINDS Outstanding Women Scientist Lifetime Research Achievement Award, traced her journey in carrying out clinical research on various disease conditions affecting newborn in Malaysia over 4 decades. Her research and clinical practice have played an important role in improving the quality of newborn care and the survival and quality of life of high-risk sick baby. Ladies and gentlemen, it was fascinating to hear Dr. Jalila Abu speak about her adventure with pet birds and wild birds and her training in medicine and surgery for our feathered friends as well as raptors. Dr. Evelyn provided a compelling account of the beauty of economics with specific reference to international trade. Professor Rebecca Wong spoke on the multipotency of mesenchymal stem cells and their increasing importance. Dr. Lam, the co-recipient of the Young Woman Scientist Award, described her internationally acclaimed work on designing various catalyst structures ranging from 0D to 3D for wastewater treatment using recyclable fuel cell technology. We heard from Dr. Nur Hafiza, the co-recipient of the Young Woman Scientist Award, that commented that cement as a key component of concrete, the most widely used construction material in the world, is a major contributor to climate change. Ladies and gentlemen, today, technologies are transforming every phase of human life. However, as technology grows in complexity and power, they will also have the potential to cause harm. As highlighted by Professor Nick Merriam, it is imperative that responsible technology innovations be based on the adoption of sustainable solutions centered on environmental, social, and governance, or ESG principles. Ladies and gentlemen, risk takers live in the realm of possibilities. They are not afraid to change the norms. They are characterized by a sense of adventure and passion. This described Dr. Shahida and team in her talk entitled "Not Seeking an Equilibrium, Going Against the Entropy." Dr. Shahida described instances where her team challenged the norm and was not afraid of failure. As we heard from Professor Lee Ping Ching, Chlamydium knowlesi has emerged as Malaysia's most prevalent malaria culprit, but it can be misidentified as the less pathogenic, leading to inadequate treatment and adverse clinical outcomes. Ladies and gentlemen, it is indeed inspiring to see the role of our Malaysian women scientists are playing in shaping the future of technology, and how critically important our voices are in forming the future. For the last 4 years, MINDS has taken the opportunity in conjunction with International Women's Days to reflect on the journey that Malaysian women have embarked on. I'm humbled and excited at the path they have created through their dedication and energy. I would like to wish everyone a very happy International Women's Day in advance. Last but not least, ladies and gentlemen, on behalf of the Malaysian Invention and Design Society, MINDS, I would like to once again thank our distinguished speakers for their excellent and insightful presentations. Many thanks also goes to panel of judges of the awards, members of the media, participants, the conference organizing committee, and all those who have in one way or another helped this conference possible and successful. Your presence and support have been invaluable and gratefully appreciated. I would also like to express very special thanks to Tan Sri Agustin Ong, President of MINDS, for his unwavering support for the role of women in science. To the students and future scientists who are amongst the participants today, I hope you got an overview of the possible career opportunity from our eminent scientists. My personal wish is for you to find your place in science or social science. Once again, thank you everyone. All the best and stay well. See you again in MINDS National Conference on Contribution to National Development by Malaysian Women Scientists and Inventors 2024. Thank you very much. Bye-bye.